Muy buenos días para
Good morning, everyone. Good morning and welcome to today's session. We have a very interesting agenda to work through, and we're ready to get started. We're going to begin with item 4.1. Preliminary report of the end-of-biennium assessment of the PAHO program budget 2022-2023, second interim report on the implementation of the PAHO strategic plan 2020-2025. I would like to bring document CE 174/12 to the attention of the committee, and I invite Mr. Ronnie Massa, Director of the Department of Planning, Budget, and Evaluation of the Pan American Sanitary Bureau, to come to the head table. Also, I now yield the floor to the President of the Subcommittee on Program, Budget, and Administration to report on this item. Good morning, and thank you, Madam President. The subcommittee reviewed an outline of the proposed content and timeline for completing the end-of-biennium assessment of the PAHO program budget 2022-2023, which will also serve as the second interim report on the implementation of PAHO strategic plan 2020-2025. Also, the subcommittee was informed of some of the preliminary findings of the assessment. In the subcommittee's discussion of this item, delegates acknowledge the importance of the end-of-biennium assessment as a key tool to ensure transparency and accountability, and also to demonstrate progress obtained and identifying areas for improvement. They reaffirmed the commitments of their governments to collaborate with the Bureau to carry out the assessment and analyze health gains, gaps, and lessons learned. Delegates also highlighted the importance of continuing monitoring and evaluation at country and regional levels in order to identify and address public health challenges, especially in the post-pandemic context. Thank you, Madam President, and this concludes my report on this item. Thank you very much, Subcommittee President. With that, I call on Mr. Massa for him to present this item. Thank you very much, Madam President. Director, delegates, good morning, everyone.
I am pleased to introduce this item on the preliminary report of the end-of-biennium assessment of the PAHO program budget for the period 2022-23 and the second interim report on the implementation of the PAHO strategic plan for the period 2020-25. As already highlighted in the summary of the chair of the SPVA, we continue to work with member states, and I want to first start by thanking our member states who have continued to work with their country offices, with their technical teams, and everyone who is involved in completing the joint assessment of the outcomes and the outputs, which is indeed a best practice that we have adopted over 10 years ago when the member states decided that we will go beyond internal assessments, and this would enrich, and we have learned so much and advanced so much in this process after 10 years, and I see some familiar faces around the table with whom we developed that process back then. To date, I'm pleased to note that 45 of the 51 countries and territories, remember that this is not just member states, this is countries and territories, and there are 51 with whom we work, and we're happy to report that we got to that number, and we hope that for the directing council we will have, I hope, beyond the 90% target, which we always aim, but we always aim at 100, but we have not gotten there before because of the different challenge agendas are very busy. But thanks again, member states, for ensuring that we get your input and that we can indeed validate the results as we advance in the implementation of the strategic plan and close another program budget. As also noted in the summary of the SPVA, this report provides us with the stock take, the collective stock take that we need to have. One, it is a requirement, it's a statutory report that we need to present to you, member states, as part of the governance of this organization, on the implementation of the strategic plan and the closure of a biennium, which is the program budget that you approve every 2 years. At this time, we have preliminary results. We advanced on the draft with the internal assessment that we did with the secretariat teams, and that includes from our country offices and all teams at sub-regional and regional level. And what you have before you is indeed an advanced report with most sections already filled in, with the exception, as I said, that we need to validate results with member states. And by the directing council, we will have the full report. But at this time, you pretty much have a complete report with the key sections I would like to highlight: delivering on results. This is where we provide a summary on how we're doing towards from the impact level to the output level that are in the strategic plan and the program budget. We also include a comprehensive analysis on the financing and implementation of the program budget. I will provide some highlights during my presentation. And a recommendation back in 2017 that our member states, 2016-17, that we incorporate risk analysis. This continues, and we continue to build on it, practice in collaboration with your colleagues in the Directors of Administration Office and across all countries and programs on risk management. We also keep, again, listening to your recommendations on how we can improve efficiencies, transparency, and accountability. In line also with our Directors' Initiative on PAHO Forward, we have looked at how we incorporate additional details that show you member states on our continuous efforts to make this organization more efficient and more effective. And also very important is that the documentation, but not just documentation of lessons learned, but how we translate those lessons learned into actions, especially at this time when we're looking at a post-pandemic and the last biennium to complete the implementation of the strategic plan, which is this biennium 24-25. So this report is very critical as we look at taking stock, but also what have we learned and what are those key recommendations, actions that we need to take to close the biennium as best as we can. And we will highlight some of those during the presentation. Here is just a reminder of our commitment to results, or results-based management approach, with definition of what we mean from the impact level to the output level. As you can see to the left on the gray scale, you have from the accountability of the Secretariat, which is higher at the output level, where we have our managerial control or managerial interest of delivering outputs, biennial results, and the outcome and impacts, where we need to work very closely with you, member states, and the partners to achieve those. No health outcome or impact can be achieved without action in country. And that, again, goes in line with our country-focused approach of working together with you to advance of the peoples of the Americas in every country and territory. We have indicators for every level to assess in line with the RBM approach. And also these assessments that we conduct also serve to inform not just our regional commitment of PAHO's governance, but also to WHO. Through this report and building on the efficiency, we also report to WHO's biennial program budget implementation and the general program of work. And with those reports, they also contribute to the reports on the SDGs, just to also put that into perspective. Now, going into the highlights of the report in terms of impact level, the highest level of improving health and well-being, reducing morbidity and mortality. These are long-term indicators that really require time. And what you see here is that when you look at that pie, you will see that one achieved 7 in progress, meaning 8%, about 29-30% of the targets we would achieve. We project this towards, if we continue with the same rate of implementation, towards 2025. That is indeed not a good picture, but that's the reality of one of the, and then 14% of those, or 50%, are in progress, but not reaching the level of performance that we need them to be. And then you have 6 of these indicators that have challenges with data and measurability. And that's a lesson that we need to learn as we look at the next strategic plan. But before we go to the next strategic plan, we need to see what we can do to ensure that we continue to make progress in those that are in yellow there and those in red. And this is what we want to call upon, is where can we accelerate progress at country level from all the efforts that we can do to ensure that we can reach as maximum as possible so that we can reflect those improvements in the health outcomes of the peoples. This also is a situation that As you know, the impact of the pandemic is one factor that we want to highlight in not progressing at the level we want, but also a lesson learned that when we set up this strategic plan back in 2019, when it was developed member states, we have realized that we were a bit ambitious as well. So in some targets, very ambitious, and some, they did not even have the data to measure. And we need to learn that lesson on the way forward as we prepare. But for now, the call to action is the point. How can we ensure that we can reach some of those targets that are very important still for our countries? When we turn to the outcome level results, we see a better picture with 9 of the 28 outcomes, again, meeting expectations. Again, these outcomes will be concluded at the end of the strategic plan by 2025. So this is something, again, we have an opportunity to focus on the partially achieved, maintaining the performance in those that are meeting expectations, but making every effort possible in this last biennium 2024-25 to reach as many as we can in the partially achieved. The levels of partially achieved vary, and we have some that are very close to achieving the targets, and we have the details in the report as well, and additional details will be included based on the joint assessment that will be completed with member states on where we have the opportunity. What you have with the stars are those priority outcomes that the majority of member states highlighted that this is where they wanted more PAHO's technical cooperation. They want to see more added value, and that's important as well as it guides us in orienting our technical cooperation efforts and the limited financial resources they have to support and work with you member states. At the indicator level of the outcomes, we also see here, as you can see from this pie chart, is that about 63% are achieved or on track. This also, the measurements are more medium term, we can see, and again, based on the interim results, we consistent more or less with the assessment that we have at the outcome level. We see here an opportunity also to focus on those that are at risk. This is the progress has not advanced, and we can still intervene. And not to forget that we can still look at the 25% there is no progress. And that's going to be an important exercise as we continue to implement Program Budget 24-25. How do we continue to protect those that are progressing well, but more importantly, those at risk and where we can still make progress in the ones in our region, 25%. In the report, we highlight again some of the recommendations that can accept. But again, the point here is we need action in those areas that are not performing at the level that they expected. At the output level, the more specific to the biennium, although some of these output indicators continue, they can go beyond a program budget. What we see here is that over 80%, or 83% to be exact, were achieved or partially achieved. Again, these are the more shorter term results, and therefore the consistency of the assessment. And once we have the assessment from member states, we will be able to see if this number, to validate this number with you. Important again, not to continue to advance on those, the 53%, where we can progress in this last biennium, but also what actions may be required to turn those not achieved into partially achieved in this final biennium of implementation of the strategic plan. Turning to the budget, just on the graphic here at the bottom, the solid colors, the brighter colors, you have what we call the base programs, and on the top you have what we call special programs, which is primarily comprised of emergency response, outbreak crisis response. Overall, from this picture, we wanted to highlight that compared to the last biennium, you will see that we had a higher budget, we had higher financing, we had higher implementation. In terms of the funding, strong funding, almost 100% of the program budget was financed, although we had revised the budget, as you will see here. You remember that in September 2022, there was an amendment driven mainly by WHO's increased budget, and we also aligned that portion of the emergency outbreak crisis response to ensure that we we were in line with the flow of funds that we were seeing at the time. And we were happy to see that indeed that budget for emergency preparedness will continue to grow. But also, importantly, as we expected and we projected back then, is that the base programs funding would also increase, and we're happy to see that more funds came while we were responding to the pandemic, and we continue to perform responding to the pandemic and our emergencies. We also saw an increased funding in the base programs, which you can see in the green there, to the tune of almost $150 million more in base. And that helped us to continue with the regular technical cooperation and advancing in those programs. Implementation was also strong, with almost 97% of the funds that were available. This is higher than any other biennium. We implemented more funds as well. This is just to show that the Secretariat delivered on implementing here and ensuring that we continue to support and work with our member states. And thanks again to our member states and partners for the additional funds that made this possible. We also want to note there, as you can see there, that over 30% indeed was higher implementation in base programs alone. Having said that, while overall very good financing when you look at numbers, but as I say, right, those are averages. When you look below that to the programs themselves, you would see that while the map, and we like to call this greening of the map, and we like to compare periods, so the last biennium, how did we close it? You will see that there is greener, that means good. We got more funding, more even funding. The greener the map, the better, no reds as we close the last biennium. However, anything below 80% should call our attention. And you will see here key programs like health emergency preparedness at 76%, the one that had the lowest. We had funding for responding to emergencies, but for preparedness, you can see that we didn't get to the 80% mark. Health system services, again, below the 80% at 77%. And then NCD's risk factors, which is chronically underfunded again, did not meet that target that we always look at, a minimum of 80%. So while we celebrate and thank for the additional funds, the earmarking of funds continues to be a challenge. We would like to have more flexibility to ensure that these funds are directed to those priorities that your member states have identified where PAHO adds value and needs to do more. Just closing, highlighting again that while, yes, we are not on track, there was significant progress. We also want to note that. Public health gains, transformative actions, those are documented in the report. We need to do more to catch up, to recover, to accelerate progress if we want to reach some of those targets, not just for 2025, but to 2030. The program budget is focused on protecting, recovering, building stronger post-pandemic, helped us to get additional resources to focus our actions. We had more funding, we had better implementation. And again, to the track record of this organization and our teams who work arduously to ensure that we are there, member states, when you need us. The lessons learned will guide us. And as I said, before we close this strategic plan and we start a new one, we want to call upon the needed actions that we need at country level with partners and our teams, of course, to do everything possible to advance and close as best as we can the implementation of the current strategic plan. With that, I'd like to committed to take note of the report. We welcome your comments, and I'll be happy to address any questions or any additional information you may have, member states. Thank you, Madam Chair.
Muchas gracias.
Thank you very much, Mr. Ronnie Massa. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I will now open the floor to the plenary for discussion.
Chile tiene la palabra.
I offer the floor to Chile. Thank you very much, Madam President, and good morning to all. Chile is grateful for this report that clearly shows the effect of the pandemic in the progress towards many of the targets that had been set forth in the organization's planning period. And that was given the organization and rapid response needed to the pandemic given the health crisis. Chile, as the rest of the region, saw its progress impacted, for example, with regards to maternal mortality. That is why we adhere to the organization's call to recover the path that had been achieved with robust, and I apologize. The PAHO rep is calling me from Chile. The PWR from Chile calling. Yes, you scold him for me, please. Go ahead. We firmly believe that universalization of primary care is crucial to maintain a healthy population, strengthening promotional and preventive actions, early detection and giving timely and effective treatment. And we're also convinced that to strengthen the link with the relevant sectors, including citizens as an active part of solutions, will take us toward achieving results. So we share fully the recommendations coming through from this study presented by Mr. Massa, because the health and well-being of population must be visible and permanently present at the highest political level, encouraging harmonious articulation and coordination of all sectors, showing positive results in the quality of life of people. With regard to what Mr. Massa presented, we'd like to know more about the reasons, beyond numbers, but the reasons why the organization believes were at the root of compliance or non-compliance with some of the indicators as just presented. Lastly, we'd like to congratulate PAHO for the work that has been done in this ambit, in particular, preparing this assessment that allows us to move forward towards achieving commitments. Thank you, Madam President. Thank you, Chile. I now give the floor to Argentina. Good morning, and thank you, Madam President. Good morning to all. We won in soccer, but not in good mood or good humor. We agree that this biennium is crucial to channel the organization's efforts towards recovery of health systems throughout the region, based on principles of equity and solidarity. We also believe that targeted measures are needed, taking into account what works well and what doesn't work well, or what could be done differently given the regional and global context and lessons learned from the pandemic. Argentina supports the strategic plan priorities, in particular those having to do with promotion of integrated care, strengthening national regulatory systems, expanding regional capacity for manufacturing, strengthening genomic surveillance, focus on primary health care, and digital transformation of systems. We're grateful for the support from the regional office and the country office to complete the end of biennium assessment of the program budget 2022-2023, reviewing the lines of work and the outcomes. What is in the plan 2020-2025 will help us reach sustainable health for the Americas 2018-2030 and those targets, and the sustainable development targets in the national and regional public health. We are sure that these efforts will help promote national and regional interventions aimed at strengthening our health systems, giving them resilience and based on lessons learned. I believe that the pandemic took us all by surprise, and took our countries also by surprise. It impacted the health services, but the organization has been present at all times, collaborating with Argentina, and we're very grateful for that. And in all these interventions, that we're all expressing desires. What we would like is that to go beyond just an expression of desire and hope, but result in specific, concrete actions. And recalling the words of our president from yesterday afternoon, when we raise health issues, let us not forget how important health was in the period 2020 and 21, not only for those of us involved in the health sector, but all the other government areas and our populations. Thank you very much, Madam President. Thank you, Argentina. I now recognize Canada.
Thank you. Good morning. Thank you to the Secretariat for this preliminary report, providing us with a really important overview of the key achievements in the region over the last 2 years, but as well a really honest perspective of the persistent and emerging challenges. We agree that this serves as a really key opportunity for us to take stock of progress, but also identify those areas that require increased collective efforts. We recognize, of course, that the 22-23 biennium was a transitional period for the region and moving from the acute phase of the pandemic to the recovery phase, and that these preliminary findings continue to showcase the really severe and disruptive impacts of COVID-19 on all of our systems, including very much in Canada. Of course, it is concerning to see that the region is not on track to achieve the impact targets established in the strategic plan, nor is it on course to reach the targets of the SHAA 2030 and health-related SDGs. And additionally, some of the backsliding that we're seeing in certain indicators, such as the maternal mortality ratio. We're at a critical juncture now, obviously, as other member states have said, to make progress, determine a forward approach that is realistic. And we look forward to hearing and learning more from the Secretariat on plans to prioritize efforts on certain targets, those that are showing a concerning trend, for example, in an aim to protect those previous health gains and mitigate the risk of regressing in some of those critical health areas. And all that to say, of course, that we look forward to developing a new strategic plan, which this will very much help inform, and that this report is really of critical value at this time to help navigate the approach that we take as a region. We very much look forward to the work of the new strategic plan and commit to being a full collaborative and cooperative partner in the engagement of that plan. Merci.
Muchas gracias, Canadá. Le ofrezco.
Thank you, Canada. United States is recognized.
Thank you, and good morning. The United States appreciates the report of the end of biennium assessment of the 2022 to 2023 program budget and the 2020 to 2025 strategic plan. Transparent evaluation and reporting on PAHO's programs and strategic plan allows member states to engage more closely with the work of the region and provide guidance and recommendations as needed. We appreciate the continued involvement of member states in reviewing and providing input on progress achieved across the strategic plan, as well as understanding areas of challenge or setbacks. The United States urges PAHO to take immediate action to address the insufficient progress and challenges hindering the achievement of targets. While noting the important progress made, such as meeting the strategic plan impact target on dengue, the prospect of 7 other indicators reaching their targets, we remain concerned by the pace of progress. More than half of the indicators are showing insufficient progress towards the 2025 targets, and an additional 20% of indicators not measured because of a lack of data. We look forward to PAHO providing further information in the results portal and corresponding actions that PAHO can take to accelerate progress and get back on track to meet the SP 20 to 2025 targets. Thank you.
Muchas gracias.
Thank you very much, United States. I now offer the floor to Mr. Ronnie Massa to respond to the comments that we have just heard.
To our member states who have made specific comments and some questions, Chile, Argentina, Canada, and the United States of America. First of all, thank you for your comments, for your commitment, for your expressions of commitment to continue to engage and to ensure that we complete this assessment with member states' input, but also highlighting the opportunities that we have at hand, and not just on taking stock, but also what can be done. As I said in my presentation, we still have 18 more months to go, and I think we have a great opportunity if we focus on those, as highlighted by Canada, on those indicators that we still can do something to recover, not just to those who are near achievement, but also where we can advance, although we may not achieve, how much progress can be made so that we can continue with that momentum into the next cycle towards the new strategic plan. Allow me to note a few comments, specific comments. Chile, thank you for your question on the reasons. I think there are several factors. One of them we cannot, as highlighted again in the analysis so far, the impact of the pandemic, and you mentioned that as well. Of course, that was an issue of setting targets that were not in tune with the reality. But in terms of what worked well, I think we can highlight, and again, before I go into what worked well, is the persistent inequities. Those were exacerbated, as has been documented also in the pandemic assessment, and those were there, and they just became more challenging to continue advancing in some areas. But what worked well, I think where we continued to work while responding to the pandemic and on those essential programs, priority programs that continue while member states and secretariat continued to respond to the pandemic, not forgetting that we had to protect. And I think from the very onset, you will recall that the director and executive manager declared we will work on responding to the pandemic, but also on where member states need to protect essential programs and health services and systems. On the commitment, the political commitment always will make that difference. Wherever we saw that emphasis, we also are seeing that. The institutional capacity, where we had institutional capacity in place and was able to maintain while addressing, the surge capacity where we had teams to continue to respond to the other programs was important. Intersectoral action, I think the issue of bringing the others, the stakeholders, to work on priority topics, because again, as we know and proven, so that it's not just first, it cannot be the Secretariat, member states, but also with all the key players. I think another point that we need to highlight is that the data that we don't have, it's an area that we need to improve, where we don't have data. That has come up in every topic that has been presented here. That's something. We will provide additional details. Thank you for that. And with your comment, we will continue to look at in detailed assessment, and we will include additional to the report. But also and thank you for highlighting USA on the results portal. We call it this digital program budget portal. We will continue to populate that and ensure that we have the details there also on it, not just on the reasons, but also the interventions. A detailed analysis will be done by each impact indicator. At this time in the report, you have a summary, but our teams are working on the detailed analysis, and we will also reflect on these very good comments that you have made. On the thank you, USA, for that analysis of the impact indicators. Again, we will go into that. Our technical teams are looking into the reasons and those areas that need attention. But as Member States highlighted, where can we protect and not backslide any farther? I think our director and executive and technical teams have already given us guidance in our internal assessment. We did the internal review, and in internal assessment, we have also identified where the Secretariat needs to take action. And that involves, again, our country offices, led by our PAHO WHO representatives in the countries. With regards to your question from Canada on where do we prioritize, indeed, we continue to be guided by that planning that we do with you for 24-25. We have that input from member states again because of the change in situation, the pandemic. We went and revisited the priorities, and we have that input from member states on where we can also, in addition to the assessment, we had the planning that we did for 24-25. And with this assessment, we will enrich again where is it that we can do, can make additional interventions. Again, details to be included in the final report. Argentina, thank you so much for your comments and the commitment. Muchas gracias, disculpe, por los.
Thank you very much. I want to thank you for your commitment, and we will continue collaborating and working to move forward with the agenda. So with that, thank you very much, Madam President. Thank you, Dr. Ronnie Massa. Let me now offer the floor to Dr. Barbosa for comments. Thank you very much, Madam President.
All the very good comments and suggestions that our member states made in this discussion. Just some brief points, because I think that Ronnie Massa covered almost everything that was important to discuss. But first, I think that it's very important to recognize that at the end of this biennium, we had better financing from the basic programs to finance the technical operation of the organization, and we also had an excellent implementation. So I think that it's important to recognize that the departments, units, teams, centers, country offices worked very hard with our member states in order to implement all the things that were planned for this biennium. About the goals that we probably we will have some challenges to achieve. I think that I agree that the pandemic, of course, responded for most part of that, but I agree with Chile that we need to go deeper. We need to review one by one what happened, what are the lessons that we learned during this project. Goals are a tricky issue because sometimes we cannot establish goals that we know from the beginning that we will achieve them, because this will not mobilize the organization. At the same time, if we put the goals that from the beginning we know that they are not achievable, this will also be not an inspiration for the organization. So we need to work in this gray area that we don't know if we will achieve, but they will serve to inspire, to mobilize, to make us review the process, to be more innovative, to be more committed. So I think that this is really a very important exercise that we have, but it's important to go one by one and to see first how we can expedite the process as suggested by Canada. And we are doing that. I think that it's important to see that the new initiatives, the initiative that we relaunched because the pandemic is suspended, the elimination initiative, is linked to several different goals, both for the strategic plan, the SDGs. And when we go one by one, we really see that if we expedite the process in the countries to adopt or to incorporate tools, strategies that are already available, we really can make a difference in the next 2 years. For instance, we can advance the elimination of cervical cancer, the elimination of TB, and many other diseases that are included in the elimination initiative. And we are working with the country, trying to expedite the process to adopt this new strategy, because you know that this is not easy. And sometimes there are several studies showing that the gap between the evidence is available and to be translated into public health initiatives, sometimes it takes 5 months. So our big challenge is to reduce this to 1 month, to 3 months. And we are also working with the councils and at the same time to provide a more comprehensive use of the tools that we already have. For instance, getting a better price, a more accessible price for molecular tests, for HPV, through our strategic fund, will make a difference for the countries that are currently paying around $20 to $25 per test. We are trying to get this down to $7 per test. So this is one example, but we can have many others. Now, with the new treatments, short treatments for TB, for instance, we can make a tremendous progress if we can increase the use of PrEP in many countries in Latin America and the Caribbean. We also can move it forward faster. So I think that this is important. Now, we also, last week, we launched the maternal health call for action in order to address the unacceptable rates that we now have in the region for maternal mortality. We are advancing the best care for NCD's agenda, because this is the only way that we can reduce the 30% of preventable deaths related to NCDs. That is the SDG and the strategic plan goal. So I really fully agree with you that we need to go one by one and not to say, okay, probably we will not achieve, but what we can do to put them on the right track, and what we can do to move it forward in a more expedited way. I think that is also important, finally, that when we are thinking to the end of the strategic plan 2025, and we will have a specific topic to present a roadmap to get your participation, your engagement in the preparation, elaboration of the new strategic plan. I think that's very important that we first that we think about the planning process and the strategic plan, that it needs to provide more clear information about what is the contribution of the Secretariat and what's the contribution from member states. So I think that we can be more accountable. If the Secretariat is performing the tasks expected by our member states in order to contribute to the countries through our technical cooperation to achieve these goals. And at the same time that probably we can reduce the number of indicators of the strategic plan. Having 29 indicators, I think that it's a challenge to be diplomatic, because it's impossible to have a real prioritization process every year, every biennium. We need to prioritize among the priorities. So this is something that tells us that this is not the best way. So probably this is a very important lesson that we learned that we need to incorporate in the discussion. So thank you very much. I think that despite all the challenges, I think that working together, the Secretariat with our country offices and the member states, now we are recovering from the negative impacts from the pandemic. We have some indicators that are showing that there is a positive movement in the region. For immunization, I think that I already mentioned, we are the region among the 6 regions that are moving faster to recover the immunization coverage that we need to prevent vaccine-preventable diseases, and in many other areas. So I think that we need to keep the momentum, to keep our good work together in order to move the region in the right direction. Thank you, Madam President.
Thank you very much, Dr. Barbosa. I would like to inform the committee that the discussions will be reflected in the final report. Moving on with our agenda, let us now see item 5.3, programming of the budget surplus. I would like to bring document CE 174/22 to the attention of the committee. And again, Mr. Ronnie Massa will be presenting it. And let me offer the floor to the president of the PASB to report on this item. Thank you, Madam President. The subcommittee reviewed a proposal for the use of the budget surplus from the 2022-2023 biennium. The surplus was estimated at $4.4 million. It was explained that in accordance with PAHO's financial regulations, any budget surplus will be used to replenish the working capital fund to its authorized level. Thereafter, any possible balance will be available for the use that the Pan American Sanitary Conference or the Directing Council may decide to make of it. Since the Working Capital Fund was fully funded at the end of 2023, the Bureau proposed to move $3.4 million to the Master Capital Investment Fund to replenish the Real Estate Maintenance and Improvement Subfund and to move the remaining $1 million to the PAHO Emergency Epidemic Fund. In the subcommittee's discussion of the proposal, delegates noted with satisfaction that the Working Capital Fund had been fully funded at the end of 2023 and expressed gratitude to the Bureau for its responsible and transparent management of the organization's finances. The subcommittee endorsed the proposed allocation of the budget surplus and therefore recommends that the Executive Committee adopt the proposed resolution contained in the annex to document CE 174/22. Thank you, Madam President. This concludes my report on the item. Thank you very much. Let me now offer the floor to Mr. Ronnie Massa to introduce this point.
Director, distinguished delegates, again, I'm pleased to provide updates further to what was discussed in the SPBA on this item on programming of the budget surplus. First, we need to thank again, echoing our thanks that I said yesterday in the financial report to our member states for making payments up to the last month of the last biennium, which allowed us to have a budget surplus. While we were not able to use it for that biennium, this becomes a surplus and becomes available so that we can continue to use these funds in the organization. First, to thank the SPBA for endorsing the proposal of the director and giving the recommendations, and based on that, we have been able to update the document and address some of the questions that member states have. I would like to elaborate on some of the points, a little bit of background. First, the Master Capital Investment Fund was created back in 2007 to provide adequate and sustainable funds for investment that otherwise would be difficult to sustain over time. The Secretariat therefore proposes the use of surpluses from the program budget to fund these initiatives. For the current biennium, as highlighted in the document before you, the Director proposes to continue to fund the renovations of the infrastructure to make our facilities, our buildings here in headquarters, and country offices safer and conducive to more efficient and effective work. The budget surplus indeed provides an opportunity to address these needs that otherwise would be difficult to finance from other sources. And of course, we can only rely on flexible funds as voluntary contributions, usually earmarked for technical cooperation programs. In terms of the Pandemic Emergency Fund, let me again note here that this fund was established to facilitate the rapid response of the Secretariat, to kickstart. This is a fund, it's like a seed fund that exists, that is there as we get the request from member states to activate a response to kickstart. Usually it oscillates around 100,000 to 150,000 for every request we get. The fund has been maintained about $1 million. Historically, at this time, the fund is about $500,000. That's the balance in the fund. And based on the recommendation from the COVID external evaluation is to put some more funding into this. So our proposal is to bring this fund from this current balance of $500,000 to $1.5 million. So we're proposing that $1 million. Again, these are not the funds for emergency response. This is to kickstart the response. Just as a way of reference, in 2022-23, for responding to the pandemic, there were over $190 million alone. So again, these are funds that allow us to establish our mechanisms while we mobilize the substantive funding to respond to the pandemic, or any events that require such funding from that seed funding. I would like to also note here that the Executive Committee last year also had approved this proposal to continue funding the phase 2 of the building renovations here in headquarters, which you have seen in the videos, and there will be an item on this, on the progress that's being made by our Director of Administration tomorrow. But I just want to note that, again, we need this funding to continue to complete those important projects that will indeed help us to be more efficient and continue to responding to our technical cooperation commitments. Thank you, Madam President.
Muchas gracias, señor Mas.
Thank you, Mr. Massa. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent and consider approving the proposed resolution presented in the annex to this document. I now open the floor to the plenary for discussion on the document. Jamaica has the floor.
Thank you very much, Madam President, and we want to recognize the work of the PAHO in the development and implementation of the program budget that has allowed us to have this balance, that has allowed us to have a surplus and allowed us to provide the surplus in the way that it has recommended. The government of Jamaica has been critical of received critical support from PAHO in terms of our response to many of our issues. Of recent time, our response to the monkeypox outbreak and the dengue outbreak that we have had. Additionally, the support that we have received through COVID-19 from PAHO has allowed us to be agile in our responsiveness, and it is coming from the ability of PAHO to be agile as well. And so we are very encouraged by the proposal as made in the submission, and we support the submission wholeheartedly. Thank you very much.
Muchas gracias.
Thank you, Jamaica. I recognize Mr. Massa for him to respond to the comment.
In Jamaica, for those comments, we're happy to know that the fund has, and our team has been there, of course. That is the commitment of the Secretariat, and indeed that's the purpose of the funds, to kickstart. With that, Madam President, thank you again.
Muchas gracias.
Thank you. Dr. Barbosa, do you have any comments on that? If not, I ask the rapporteur to present the proposed resolution. Thank you, Madam President. Proposed resolution. There is also a footnote on this resolution, and it says, unless otherwise indicated, all monetary figures in this report are expressed in U.S. dollars. That's the end of that footnote. Proposed resolution, programming of the budget surplus. The 174th session of the Executive Committee, preambular paragraph 1, having considered the report on the programming of the budget surplus, document CE 174/22, and PP2, noting that the provisions of Financial Regulation 4.6 of the Pan American Health Organization stipulates that any balance of the funded assessed contributions and budgeted miscellaneous revenue not committed at the end of the current budgetary period or not authorized to be carried over into the subsequent budgetary period shall be used to replenish the working capital fund to the authorized level, and thereafter any balance will be transferred to surplus and will be made available for subsequent use in accordance with the resolutions adopted by the Pan American Sanitary Conference or the Directing Council. Resolves. Operative paragraph, to recommend that the 61st Directing Council adopt a resolution along the following lines. Programming of the budget surplus. The 61st Directing Council, preambular paragraph, having considered the report on the programming of the budget surplus, resolves. Operative paragraph, to approve the allocation of the 2022-2023 budget surplus totaling US $4,443,423.38 as follows. A, $3,443,000 $1,423.38 to replenish the Master Capital Investment Fund, Real Estate Maintenance and Improvements Subfund, and B, $1 million to replenish the Emergency Epidemic Fund of the Pan American Health Organization. That is all, Madam President. Thank you very much, Rapporteur. I now offer the floor to the plenary for discussion. Very well. It seems that there are no objections, so we declare this resolution adopted. We can move ahead with 5.4, which is programming of the revenue surplus, and that is document CE 174/23. Also, that will be presented by Mr. Ronnie Massa, and I call on the president of the subcommittee for him to report on this item. Thank you very much. The subcommittee reviewed a proposal for the use of the revenue surplus from the 2022-2023 biennium. The surplus was estimated at $30.8 million. It was explained that, in accordance with PAHO's financial regulations, any revenue surplus is to be used in subsequent budgetary periods to cover any unfunded portions of the strategic plan. The Bureau proposed moving $14.3 million of the surplus to the Real Estate Maintenance and Improvement Subfund of the Master Capital Investment Fund in order to complete the modernization of PAHO headquarters building and allocate $16.5 million to programmatic priorities of the PAHO program budget 2024-2023, in particular to support chronically underfunded thematic areas. In the discussion, the subcommittee endorsed the proposed allocation of the revenue surplus, and the Bureau was asked to provide additional information to the Executive Committee on which programmatic priorities would receive this funding. Thank you very much, Madam President. This concludes my report. Thank you. I call on the Executive Committee to take note of this report and to make any pertinent comments. I offer the floor to the plenary for discussion.
Muy bien, no viendo comentarios. Señor Massa, ¿quiere hacer alguna puntualización?
I hear no comments. Mr. Massa, do you have any comments? No, merely to thank the subcommittee for this guidance and also to thank the member states that have supported this proposal. Thank you, Mr. Massa. Director? I would only like to say that having a surplus is good, but it's bad too. So I'm going to say that to the member states. The truth is, the surplus is the result of, first of all, excellent implementation, but also we had the capacity to mobilize more voluntary contributions than in the previous biennium. So I think that this is a way to finance some areas that have been subfunded in the past, and at the same time to have a cautious financial management structure. And I think that it's good to be cautious. But the idea is that with the new international advisors that were approved for country offices with resources from WHO to support that 20% increase in the quotas approved by member states, I think that our expectation is that we will also be able to expand our implementation. My final point is that some of the resources that we received at the end of the biennium, that meant that since they came at the end of the biennium, we didn't have much time to implement. So we worked with donors, and we also worked with WHO, calling for greater predictability. that would be helpful so that these funds can be used in the best possible way. I think that surplus, the surplus that we had when we compared to the biennium's budget, is a minor proportion, but half of it is going to cover some work programs that had been poorly financed. I remember programs in a previous presentation. Now, nothing is in red, everything is properly funded. Some were close, but they had not reached the 80%. For example, non-communicable diseases. Another one that will receive further support is digital transformation of the healthcare sector. There, the demand for technical cooperation has increased substantially. So I think that this will provide for greater budgetary justice as we fine-tune the use of these resources, giving them to those programs that need them the most. Thank you. Thank you, Director. I inform the committee that the discussion will be reflected in the final report.
Bueno, concluimos esta primera parte.
Very well, that brings us to the end of the first part of the morning program, so we're going to take a coffee break and we will resume our discussion in 30 minutes. Thank you.
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving.
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Buenas. Hola, Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica sectorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo, otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se le solicita a la voluntaria de salud y a la paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo, les damos charlas a las madres, como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo Desde allí estoy yo pendiente. Estoy con el celular, me llamo. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora. 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer eso.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso de apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándoles capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre
Bueno, bienvenidos a todos nuevamente.
Welcome back, everyone. Let us continue with this agenda. Our next item is 3.2, PAHO Award for Health Services Management and Leadership 2024. I would like to bring to documents CE 174/5 and Addendum 1 to the attention of the committee. Following the procedures for the PAHO Award for Health Services Management and Leadership, the award committee met on 24 and 25 June 2024 and assessed the relative merits of the candidates with regards to the following. The award is conferred on a candidate who has made a significant contribution in his or her home country and or throughout the region of the Americas to improve the development of health systems, the organization, management, and administration of health services, the development of programs, projects, or initiatives that have demonstrated impact on population coverage and access to health services, the expansion of health services to meet the needs of the population, in particular those in situations of greatest vulnerability, the development of quality programs and patient safety programs at the national or institutional level, the organization and management of primary care services at the community level, the development of integrated networks of health services, including hospital services, or the production of knowledge and research to achieve change in health service delivery. The award is conferred in recognition of work completed in the 10 preceding years. I invite, therefore, the representative of the award committee, Dr. Olga Cabello Henry, delegate of the United States, to present the report.
Thank you, Madam President. This is the report of the Award Committee of the PAHO Award for Health Services Management and Leadership 2024. The Award Committee of the PAHO Award for Health Services Management and Leadership 2024 is composed of delegates of Guyana, the United States of America, and Uruguay. The Award Committee met on 24 and 25 June 2024 during the 174th session of the Executive Committee and examined the information on the candidates nominated by member states, namely Dr. Alexander Leon Sanchez Cabo from Costa Rica, Dr. Felix Antonio Chong Marin from Ecuador, Dr. Jenny Elizabeth Benalcázar Mosquera from Ecuador, and Dr. Jean-Patrick Alfred from Haiti. The award committee recommended that the PAHO Award for Health Services Management and Leadership 2024 be granted to Dr. Jean-Patrick Alfred. The award committee recognizes the merits of the 4 candidates and in particular those of Dr. Jean-Patrick Alfred for his leadership in the development of health policy initiatives during his professional career, and in particular Haiti's 2021-2022 health plan, whose primary care healthcare approach has strengthened the health systems and made it more resilient and people-centered. The committee recommends that the Executive Committee adopts a resolution along the following lines. The proposed resolution: PAHO Award for Health Services Management and Leadership 2024. The 174th session of the Executive Committee, having examined the report of the Award Committee of the PAHO Award for Health Services and Leadership, document CE 174/Addendum 1, bearing in mind the provisions of the procedures and guidelines for conferring the PAHO Award for Health Services and Leadership, previously known as the PAHO Award for Administration, as approved by the 56th Directing Council in 2018. Resolves: 1. To congratulate the candidates for the PAHO Award for Health Services Management and Leadership in 2024 for their professionalism and outstanding work on behalf of their countries and the region. 2. On the recommendation of the Award Committee, to confer the PAHO Award for Health Services Management and Leadership 2024 to Dr. Jean-Patrick Alfred for his leadership in the development of health policy initiatives during his professional career, and in particular Haiti's 2021-2022 health plan, whose primary healthcare approach has strengthened the health system and made it more resilient and people-centered. 3, to transmit the report of the award committee of the PAHO Award for Health Services Management and Leadership 2024, document CE 174/5, Addendum 1, to the 61st Directing Council. Thank you.
I thank the representative of the award committee, Dr. Olga Cabellos Henry of the United States of America. I now yield the floor to the plenary for the discussion.
Uruguay tiene la palabra.
Uruguay has the floor.
Gracias, señora presidenta.
Thank you very much, Madam President. Uruguay would like to sincerely thank all of those nominees to the PAHO Award for Health Services Management and Leadership. Their contributions have been very meritorious. We would like to point out that our country calls on professionals and hopes that member states will continue to nominate candidates. On behalf of Uruguay, once again, we want to express our appreciation for the candidates' valuable contributions. Thank you. Thank you, Uruguay. Very well. Since there are no objections, the resolution is adopted. We continue with item 3.8, appointment of one member to the audit committee of PAHO. And I call to the attention of the committee document CE 174/11, and I would call on Dr. Miguel Burnier da Silveira to approach the front table. And I also give the floor to the president of this subcommittee for him to report on this agenda item. Thank you, Madam President. The subcommittee was informed that the term of office of one of the members of the audit committee would expire in June 2024, and consequently was necessary for the executive committee to appoint a new member. The subcommittee was asked to review the list of candidates proposed by the director and to make a recommendation to the executive committee. To that end, the subcommittee established a working group consisting of the delegates of Bahamas, Ecuador, and the United States of America. The working group evaluated the proposed candidates on basis of the criteria for membership set out in the terms of reference of the audit committee and decided to recommend the appointment of Ms. Elizabeth J. Folsom to fill the vacancy on the audit committee. The subcommittee endorsed the recommendation of the working group and therefore recommends that the executive committee adopt the proposed resolution contained in Annex B of document CE 174/11, appointing Ms. Elizabeth J. Folsom to serve as a member of the PAHO Audit Committee for a term of 3 years from June 2024 through June 2027. Thank you, Madam President. I thank the subcommittee president and I call on Mr. Miguel Burnier.
Member states, Deputy Director, Assistant Director, and distinguished colleagues. The Audit Committee provides the Director and Member States through the Executive Committee with independent expert advice on the operation of the organization's financial controls, reporting structures, and other audit-related controls. The Audit Committee is composed of 3 members appointed by the Executive Committee. Members serve no more than 2 full terms of 3 years each. The current members of the Audit Committee and their terms of office are as follows: Mr. Martin Guzdan, who presented the Audit Committee report yesterday, and he's serving a second term of 3 years that ends this week. Mr. Alan Siegfried, who is serving a second term of 3 years through June 2025, and Ms. Sarah Greenblatt, who is serving a first term of 3 years through June 2026. In March this year, during the 18th session of the Subcommittee on Program Budget and Administration, a working group was created to evaluate the candidates proposed by the Director. As the President of the SPBA has mentioned, the working group recommended Ms. Elizabeth J. Folsom for nomination to the Audit Committee, and the SPBA endorsed that recommendation. The Executive Committee is invited to consider the candidate recommended by the SPBA to fill the upcoming vacancy in the Audit Committee for a term of 3 years, and consider adopting the proposed resolution in Annex B to the document you have received for this agenda item, document CE 174/11. Thank you.
Muchas gracias. Se invita.
Thank you very much. The Executive Committee is invited to take note of this report and consider adopting the proposed resolution in Annex B. I now open the floor for the plenary to discuss. Very well, I hear no request for the floor. So I would ask Dr. Boromir da Silveira if he has any further comments. Director, do you have any comments?
On behalf of Dr. Barbosa, I'd just like to thank the members of the working group, the Bahamas, Ecuador, and the USA for the work they did in reviewing the proposed candidates and making the selection. Thank you.
Muchas gracias, doctora Silly Thomas. Le pido al señor.
Thank you. I would ask the rapporteur to present the proposed resolution. Thank you very much, Madam President. Proposed resolution, appointment of one member to the Audit Committee of PAHO. The 174th session of the Executive Committee, preambular paragraph 1, considering that the 49th Directing Council, through Resolution CD 49.R2 of 2009, established the Audit Committee of the Pan American Health Organization to function as an independent expert advisory body to the Director of the Pan American Sanitary Bureau and PAHO member states. Preambular paragraph 2. Guided by the terms of reference of the Audit Committee, which established the process to be followed in the assessment and appointment by the Executive Committee of the members of the PAHO Audit Committee, PP3, noting that the terms of reference of the committee stipulate that members shall serve no more than 2 full terms of 3 years each. PP4, considering that a vacancy will exist in the Audit Committee of PAHO, resolves. Operative paragraph 1. To thank the Director of the Bureau and the Subcommittee on Program Budget Administration for their thorough work in identifying and nominating highly qualified candidates to serve on PAHO's Audit Committee. OP2, to appoint Ms. Elizabeth J. Folsom to serve as a member of the Audit Committee of PAHO for a term of 3 years as of June 2024 through June 2027. That is all. Thank you very much, Mr. Rapporteur. I offer the floor to the plenary for discussion. Very well. If there are no objections, the resolution is adopted. With that, we move to 4.3.3, engagement with non-state actors. Let's go to document CE 174/6 And I call on the chair of the subcommittee for him to report on this agenda item. Thank you very much. The subcommittee considered a report on the steps taken by PAHO in 2023 to implement the Framework of Engagement with Non-State Actors, or PHINSA. The subcommittee was informed that the Bureau conducted more than 300 standardized due diligence and risk assessment reviews, and around 97% of the collaboration proposals were approved. Also, the Bureau continued to coordinate its activities with the WHO Secretariat and with PHINSA focal points from other regions to ensure coherent implementation of PHINSA globally. The Bureau also continued to provide guidance and training on PHINSA for staff. An online PHINSA training course was launched in 2023. The subcommittee welcomed the Bureau's efforts to increase engagement with non-state actors and applauded its PHINSA training efforts, including the launch of the online training course. The Bureau was encouraged to establish performance indicators to facilitate the monitoring, evaluation, and improvement of training programs, and to provide updates on relevant outcomes. Concern was expressed regarding decisions made at the 154th session of the WHO Executive Board that might weaken PHINSA. Member states were encouraged to attend the forthcoming sessions of the WHO Executive Board and its Program Budget Administration Committee, and to emphasize the importance of protecting PHINSA. Thank you very much, Madam President. This concludes my report. Thank you very much for that information. The Executive Committee is invited to take note of this document and to provide any comments it deems pertinent. I call on the plenary for discussion. Brazil has the floor. Thank you very much, Madam President.
PHINSA, both at WHO and at PAHO. We therefore consider it very positive that nearly all proposed engagements, 97%, have been approved last year. While we commend the Bureau for the efforts in applying the framework last year in over 300 instances, we concur with the report that increased efficiency and a faster response time will be welcome. In that regard, we would like to inquire about possible projects and trainings that could help respond more quickly to proposed engagements. Thank you.
Thank you, Brazil. I recognize Argentina. Thank you, Madam President. Argentina takes note of this document, and we want to congratulate the organization for applying PHINSA in a coherent, uniform manner, taking into account the rules of PAHO. Our country has promoted the full implementation of the framework for cooperation with non-state actors. We understand the importance of working with NGOs, entities from the private sector, philanthropic organizations, academia, especially with strategic areas for the organization. For example, access to essential medicines. Regarding our engagement with non-state actors, we understand it's important for processes to be subject to due diligence. We agree with the document, and we also support the work done by Focal Points and PHINSA. We appreciate their work and their training efforts working with country offices. Now, regarding the challenges that still persist, we hope to hear of the progress of projects that are underway so as to give ever quicker response to proposals in emergency areas and in areas that are not in a situation of emergency. Thank you. Thank you, Argentina. I recognize Canada.
Gracias. Very briefly, Canada really does consider the safeguarding of PHINSA to be a critical part of the effectiveness of PAHO and the WHO. Really, it's at its core, it's an agreement among member states for these organizations to engage in specific ways with specific NSAs in accordance with agreed criteria assessed by the Secretariat. Just wanting to note how the Americas region really demonstrated great cohesion on this issue at our recent PBAC. And do you need me to lower the mic, Nelson? Oh, sorry. Perdón, I thought USA was asking me to lower the mic. Thank you again to the Americas region for demonstrating really great cohesion on this issue at PBAC and EB most recently, and with raising strong arguments in support of Secretariat recommendations and FENSA principles. We really applaud the regional cohesion that was demonstrated in safeguarding FENSA and in trying to build consensus on the decision. Merci.
Muchas gracias, Canada. Thank you, Canada. I recognize the United States.
Thank you very much. The United States appreciates the Secretariat's update on PAHO's implementation of the framework engagement with non-state actors and its engagement with non-state actors. The United States highly values the role of NSAs in protecting and promoting public health. They have been critical partners in informing and implementing some of our most successful programs and championing issues that aren't always on the front pages. And we certainly believe that FENSA has made a positive difference in this regard. We also believe that a diversity of science-based perspectives is healthy for member states to hear. We do not have to agree with every non-state actor's opinion, but if they meet the stringent criteria that member states help to create, PAHO and also, of course, WHO will have more valuable discussions. While we were disappointed the fact that the WHO Executive Board members were not able to reach consensus on admissions of new NSAs that have met with FENSA criteria, we are heartened to see indeed strong support from the region for FENSA, including, of course, at the 155th Executive Board meeting earlier this month. We remain committed to maintaining the ability of WHO and PAHO to tap into crucial partnerships to meet global public health goals. And finally, we welcome the new additions into official relations with PAHO that will be considered in the next agenda item, and are grateful for their continued partnerships with the renewed organizations. Thank you very much.
Muchas gracias. Thank you, United States. I offer the floor to Dr. Miguel Burnier da Silveira for him to respond to the comments. Thank you, Brazil, Argentina, Canada, United States of America, for your comments. As Brazil was saying, the Secretariat continues to make efforts to improve the efficiency of the process. As we say in the report, we had close to 300 applications last year, and our average response time was 7 days. So the process is efficient, but we continue to explore with the director ways where we can continue to make the process quicker, but at the same time, we want to be sure that we comply with all of the criteria that are part of the process. Now, the Secretariat is involved proactively with a whole gamut of non-state actors. The Secretariat does due diligence. We do risk assessments through a well-defined process, as is spelled out in the framework. If we identify risks, the Secretariat determines whether or not they can be managed or mitigated, and looking at the risks and weighing them against the expected benefits. Information obtained from PHMSA review
have been essential to improve strategies and to optimize our collaboration with NSAs. The Secretariat expresses its appreciation to all member states for their support in implementing FENSA by working together. We are strengthening the framework that allows us to work efficiently with a whole gamut of partners and at the same time improving our capacity to deal with healthcare challenges in the region. Thank you. Thank you. I recognize the Assistant Director for her comments.
Madam President, and I want to thank the delegates from Brazil, Argentina, Canada, and the USA for their comments. As were very well articulated by Argentina and the USA, we need the non-state actors to bring that diversity and enrich discussions to the organization and to member states. But in doing that, we also need to ensure that there's integrity, and we recognize that we need to improve our efficiency to make sure that the process is continue in a very coherent manner. I will also, on behalf of the Director, would like to thank member states for the support of FENSA shown in Geneva at the Executive Board, and to assure you that we will continue to improve the efficiency of FENSA. Thank you.
I thank the Assistant Director. I would like to inform the committee that the discussions will be reflected in the final report. With that, we can go on to
Muy bien, continuamos.
Very well. We now go to 3.4, non-state actors in official relations with PAHO. I bring to the attention of the committee CE 174/7, and I invite Mr. Luis Jimenez McInnes, Director of the Department of External Relations, Resource Mobilization and Partnerships of the Pan American Sanitary Bureau. I ask him to come to the head table. Also, I yield the floor to the president of the subcommittee for him to report on this agenda item. Thank you very much. The committee examined the information provided by the Office on Non-State Actors and also a request to find the relations with PAHO, and this in terms of those maintaining relations with PAHO. The Bureau recommended approval of the requests and recommended continuing with official operations with 9 of the non-state actors. We recommended postponing for 1 year the examination of collaboration with one of the applicants to give that entity more time to resubmit the information. The information was facilitated by the committee, and we recommend to the Executive Committee approval of the following non-state actors that wanted to establish an official relationship with PAHO: Corporate Accountability, the Rockefeller Foundation, Healthcare Without Harm, Medicines for Malaria Venture, PATH. The subcommittee also approves renewal of the relationship with Action for Non-Smoking and Health and the World Partnership for Tobacco Control, also the National Alliance for Hispanic Health, also the American Speech Language Hearing Association, Campaign for Tobacco-Free Kids, Drugs for Neglected Diseases, the Sabine Vaccine Institute, also the Latin American Society for Nephrology and Hypertension. It is recommended that they finalize the collaboration plan for the next 3 years. It is approved that we approve the proposed resolution that is in Annex D of document CE 174/7. Thank you very much. And this concludes my report. Thank you very much, and I recognize Mr. Jimenez Martinez for him to present this item. Thank you very much. Thank you, Madam President. Thank you, Director, and good morning, members of the Executive Committee. It is a privilege to present item 3.4 on non-state actors in official relations with PAHO and the recommendations that were made by the subcommittee. The official relations are based on a 3-year plan of collaboration with PAHO, and they formulate and agree upon actions. The 3-year plan has to be structured in keeping with the strategic plan of PAHO and cannot have any objective that is for-profit or commercial in nature. The non-state actors in official relations make significant contributions to PAHO, and consequently they bring progress in public health in the Americas. Some of the activities carried out by these entities up for renewal include technical assistance to the Ministry of Health of Ecuador, also working with training of more than 100 pathologists that are involved in speech therapy. Also, it supports discussion of laws and tobacco control in Costa Rica, Jamaica, Peru, and 3, also producing and distributing materials to inform, educate, and motivate healthcare personnel, and also do rapid diagnostic tests. Also, activities with healthcare authorities to create dialysis registries at the national level and transplants in 20 countries. The subcommittee recommends approval, first of all, of 7 new requests for admission to official relations, and this is a record number of applicants. I wanted to say that in the last 3 years, the number of applications has been between 1 and 2, and this year we bring you 7 applications. And I repeat, this is important for the committee. We have corporate accountability to the Rockefeller Foundation, Medicine for Malaria Venture, 4, PATH, 5, Health No Harm, Task Force for Global Health, and Vital Strategies, number 7. To continue official relations with PAHO with the following 9 organizations. 1, Action on Smoking and Health. 2, World Alliance for Tobacco Control. Hispanic Health, American Speech Language Hearing Association, Campaign for Tobacco-Free Kids, Latin American Federation of the Pharmaceutical Industry, Drugs for Neglected Diseases Initiative Latin America, also the Latin American Society for Nephrology and Hypertension. And then there was deferral of the application presented by the Inter-American Heart Foundation. The subcommittee has not recommended interrupting any relationship. Thank you. Thank you. I call on the Executive Committee to consider the possibility of approving the proposed resolution contained in Annex D. And I now open the floor to the plenary for discussion on the document presented. Very well. We have no request for the floor, so I'm going to call on Dr. Guillermo Alvarez-Esteves to refer to non-state actors in official relations with PAHO. Thank you, distinguished members of the Pan American Health Organization. The Latin American Nephrology Society appreciates your allowing us to work with you in fighting chronic renal disease and the effects on mobility and mortality and the impact on healthcare budgets in Latin American countries. We have implemented joint projects in doing early prevention and detection of chronic renal disease in primary health care. We have promoted registries of patients on dialysis, transplant patients, so as to look at incidence, prevalence, mortality index. All of these are important tools to realize what the burden of disease is, and so as to have an impact on public policy, so as to decrease the penetration of renal disease in our countries. Also, today we are commemorating the first time that the Minister of El Salvador, Dr. Maria Isabel Rodriguez, is personally describing the catastrophic situation of chronic renal disease on agricultural workers in Central America. This executive committee approved in its 152nd session in 2013 a resolution to deal with chronic renal disease due to non-traditional causes, and that has had a very impressive result in the Central American region and worldwide, because a new entity has brought a revolution to this field globally. We have made major strides in prevention, diagnosis, treatment, and in reducing the mortality of so many people caused by this disease. We still have much to do, and we face major challenges in fighting against the impact of renal disease that results from climate change and also our struggle to reduce hypertension and diabetes that can lead to renal disease. We hope that together we can bring hope to those suffering from renal disease in Latin America. Thank you very much for your attention. Thank you, Director, from the Latin American Nephrology and Hypertension Society. Now I recognize Ms. Levy Laufstum from the American Speech, Language, and Hearing Association.
Buenos días.
Good morning, Madam President, distinguished delegates from the various countries, and also my congratulations to all the members here present. The American Speech, Language, Hearing Association, known as ASHA because of its acronym, as we're widely known, we would like to express our gratitude for the joint cooperation we've had with PAHO. We've had this long cooperation for 11 years, cooperating in our professions on speech and hearing therapy. In many countries, in Latin American countries, they call our professions phonoaudiology, which is a combination of both. We are very happy with the impact that can already be witnessed in participating countries in this joint program. As Mr. Luis Jimenez just mentioned, with the work we do in Ecuador, with the Ministry of Health, we were able to provide a training to 25% of the professionals in the country. Another example is in Honduras. Our support, our technical support, was with the National Autonomous University of Honduras. And a new program of phonoaudiology, as we call it, was created. Last year, 24 students graduated from the program, new professionals in audiology and speech and hearing, for the first time in that country. And next year, we will have 47 new professionals graduating from this program in phonoaudiology. So we hope that we can continue with this cooperation for a long time in the future, because the need that we face in countries is patent, is obvious. We have overcome several challenges, and with the pandemic, we have learned a lot in connection with this topic, but we follow enthusiastically and we continue forging ahead. Thank you very much. Thank you very much, Ms. Wallstone. Now I give the floor to Mr. Jimenez McKinney. Do you have any answers to the comments that we just heard? Thank you very much, Madam President. I simply wished to acknowledge the work done by non-state actors, what they share with us as PAHO. I believe that we should be happy to have two representatives from these entities, these organizations that are subject to renewal in their official relations on the work we do jointly. As I said that, the first one, which is technical assistance to the Ministry of Health of Ecuador, I had not mentioned the entity, but we do have them present here with ASHA. And the fourth one, which was activities with health officials in order to create national registries of dialysis and transplants. We have the Latin American Society of Nephrology and Hypertension. So it was simply to acknowledge the work they do and to continue forging ahead with the guide of the committee. Thank you. Thank you very much. And I now give the floor to the Assistant Director, should you have any comments in this regard.
President, just to join Mr. McInnes in thanking the two organizations who took the time to come here to highlight what some of our member states actually articulated in the previous agenda item, the value that non-state actors bring to the organization. So thank you.
Muchas gracias.
Thank you very much. I would ask the rapporteur to please submit to our consideration the proposed resolution. Thank you, Madam President. Proposed resolution. Non-state actors in official relations with PAHO. The 174th session of the Executive Committee, PP1, having considered the report of the Subcommittee on Program, Budget, and Administration on non-state actors in official relations with PAHO, document CE 174/7, PP2, mindful of the provisions of the framework of engagement with non-state actors adopted by the 55th Directing Council through Resolution CD 55.R3 2016, which governs official relations status between the Pan American Health Organization and such entities, resolves OP1 to admit the following non-state actors into official relations with PAHO for a period of 3 years. Little a, corporate accountability. Little b, healthcare or Rockefeller Foundation. Little c, medicines for malaria venture. Letter d, path. Little e, health care without harm. Little f, task force for global health. Little g, vital strategies. OP2, to renew official relationship between PAHO and the following non-state actors for a period of 3 years. Little a, action on smoking and health. Little b, Campaign for Tobacco-Free Kids. Previously, it was known as the Framework Convention Alliance, now Global Alliance for Tobacco Control. Now Latin American Federation of the Pharmaceutical Industry, the National Association Campaign for Tobacco-Free Kids, Latin American Society of Nephrology and Hypertension, Latin American Federation of the Pharmaceutical Industry, in Drugs for Neglected Diseases Initiative Latin America, H, Sabin Vaccine Institute, E, Latin American Society of Nephrology and Hypertension. OP3, to defer review of the following non-state actor to allow time to finalize the collaboration plan for the next 3 years without compromising existing engagement. Little a, Inter-American Heart Foundation. OP4, to request the director to, little a, advise the respective non-state actors of the decisions taken by the Executive Committee. Little b, continue developing a dynamic working relationship with inter-American non-state actors of interest to the organization in areas that fall within the program priorities that the governing bodies have adopted for PAHO. Little c, continue fostering relationships between member states and non-state actors working in the field of health. That is all, Madam Chairman. Thank you very much, distinguished rapporteur. Floor is now open for discussion.
Muy bien. No...
Very well. Having no objections, so we consider this resolution as adopted.
Les voy a hacer alguna consulta.
I have a question for all of you. Let's see what you think. It is early. We've been working hard this morning. And in order to get ready for the meetings that we have during lunch and after lunch, if it is okay with you, and if there are no objections, I propose that we move on to item 7.1, Roadmap for Developing the Strategic Plan of the Pan American Health Organization 2026-2031, document CE 174/INF/1. Is that okay? Is that agreeable to all? Very well, thank you.
Bueno, ahora sí, formalmente vamos.
Now, formally, we move on to agenda item 7.1, Roadmap for Developing the Strategic Plan of the Pan American Health Organization 2026-2039. I bring to your attention document CE 174/INF/1, and I invite Mr. Ronnie Massa, Director of the Department of Planning, Budget, and Evaluation of the Pan American Sanitary Bureau, to come to the head table and present the item.
Thank you, Madam President, Madam Assistant Director, distinguished delegates, colleagues. I am pleased to provide an overview of the proposed roadmap for developing the next PAHO strategic plan for the period 2026-2031. The document before you includes details. I will highlight a few aspects of the plan. We are very excited here, and I just want to say that, as we discussed earlier, strategic planning is always that opportunity for us to create vision, but not just envisioning, but also the opportunity for us to see where change is needed, where do we need to adjust, and where can we improve to continue moving the agenda forward, most importantly, impacting the peoples of the Americas' health. I also want to highlight that last week, to thank those member states who were able to join in the first informal session that we had last week, Thursday, where we had, I believe, about 24 member states who were able to join us in having the first informal consultation to get an initial input, as we do intend, as we have highlighted before, to build this with the input of all member states. With that said, allow me to just go over some of the slides. In terms of the context, it's important to highlight that the strategic plan serves to set that medium strategic direction for the organization. We develop it every 6 years, and it's usually done building on good practice with our member states. The plan defines the collective priorities. Again, this is where we have the opportunity to look at where is it that member states would like PAHO to focus in the next 6 years. Considering PAHO's added value, this word is always mentioned, where are the priorities for PAHO's technical cooperation? And by getting that input from member states, we ensure that it is guided by that evidence and based on relevance, needs, and the need to respond, of course, to those needs in member states. Driving impact in countries is important. How do we ensure that these plans respond to the needs, but impacting, again, the people's health? Addressing inequities, we have said these are important considerations. We keep mentioning this. All our strategic plans will always focus on addressing those where we need to reach, where we don't normally reach, and ensuring that those who need the most can get that support from the organization, but also together with member states intervening where a difference can be made. It responds also, it provides the opportunity to implement what has been agreed at global level. Most importantly, at this time, as last month, the Health Assembly, 77 World Health Assembly approved the General Program of Work. So we have a lot of input from there. How those global commitments are also incorporated, but recognizing the balance that we need to have, that first it responds to countries and regions while responding to those global commitments that member states have also endorsed and committed to implement. This will be the last strategic plan to complete the implementation of the Sustainable Development Agenda, the SDGs for 2030, and the Sustainable Health Agenda for the Americas. So this plan is very critical to ensure that we have this opportunity to, as mentioned in the last item we discussed on the assessment of the current strategic plan, to where we can accelerate advanced progress to close gaps will be important. The country cooperation strategies here at PAHO, we use a lot of acronyms, as you can see. The CCS, I hope you all know it in countries, is the country cooperation strategies, the medium-term strategic framework that translates PAHO's actions into the commitments and interventions so that we can also work addressing the specific priorities of the countries. But also, importantly, those mandates, member states, that are approved through the governing bodies, several of those strategies, plans of actions, policies that are being discussed in this very forum will, of course, need to be incorporated into the strategic plan so we can translate them into the interventions and eventually the program budget, which will have the resources to respond and implement. Of course, it's always not just important to reflect, but act upon the lessons that we have, a lot of them from the current implementation of the current strategic plan, but also through the external evaluations, a lot of recommendations that we have gathered, recommendations also from audits, that recurrent issues that, again, the strategic plan provides the opportunity for us to improve upon and build forward. Here is the summary of the timeline that we have put forward for your consideration. As you can see here, is structured in 3 phases. The first one, the preparation, of course, of the whole process. We have been investing time on this internally. And again, the last week's first consultation with served us to already gather some initial input. Rest assured that what we underline there across the 3 phases, as you can see there, the consultations, member states, and stakeholders from the beginning to the end will be critical. Phase 2, analysis and drafting. So once we have input, how do we bring all that together? How do we consolidate? How do we put all that input into something that then reflects the collective priorities that member states are saying this is where PAHO can really make a difference going forward. And then phase 3, the refinement. Once we have all that input, how do we put it together in a document that is strategic, executive enough, not too long, and that everybody understands. That everybody can see that this is what we mean with results, with interventions, and how we will measure the implementation. We will continue as part of this, and based on the concrete recommendations of the external evaluation and the external auditor's recommendations on results-based management, we will update in tandem the results-based management framework, which our director highlighted yesterday as a commitment. Also, during this process, as we develop the new strategic plan, we need to present to you next year as well the first program and budget to operationalize the strategic direction vision from the plan. Country strategic input prioritization is key. We have been reflecting here internally with director, executive management, and our teams on how do we get that input from the onset from member states. We're not going to come to you with a menu this time. We're planning to get that input first from the countries and then organize it to formulate the strategic agenda. That will serve us not just for the strategic plan, but also the country cooperation strategies. Building on efficiencies, how do we ensure that consultation, we often hear that people are very busy, a lot of activities going on, and we have several consultations. So we want to have one consultation that serves, hopefully, those 2 processes: strategic planning at country level for PAHO's technical, and strategic planning for the corporate or regional level. Below you have the specific milestones. We start with this milestone here where we present the roadmap to you. and we look forward to your guidance. And I think that we can incorporate to ensure it is clear and that it responds to your expectations. By September this year, we will present to you a more updated, comprehensive document that will already consider some of the input that you will provide us. We're planning to continue with the consultations next month. And then going back to the governing bodies cycle again next year in the SPVA, we will have the first outline, the first document that you will be able to see how we are putting together that input that's coming from our member states and partners. And we continue with the cycle that by June next year, so 1 year from now, you will have the first draft, the first complete draft, which will then be fine-tuned, finalized for your consideration, again, at the 62nd Directing Council in September next year. So we have about a year and 3 months. It sounds like a lot. That's very short. But we trust that with the lessons that we have from the consultations that we have embarked before and how we work with member states, with the technology that we have, virtual means, reaching member states, with the experience that we have of working with you, with the engagement of the whole organization, and the priority this process deserves, and the commitment we already heard from you last week, that we will be able to reach that last milestone and deliver, as we must do. We have no option but to have a strategic plan that reflects, again, the country's priorities and our commitments to the mandates and translating those mandates into actions that will make a difference at country level. Let me highlight here the point about stakeholders. If you notice, we are proposing not just to consult member states, but also stakeholders. This is a lesson and experience we saw from the General Program of Work of WHO that was developed, that if we really want to translate into concrete commitment and actions, intersectoral collaboration going beyond the health sector, we need to involve actors from the onset. Because health, it has been proven, requires that commitment, that input from, so that we can have an agenda that is also serves those who contribute and are required to implement the agenda that we agree on. I just want to highlight some of the enhancements on the document. You will see details on this. As we mentioned already, the RBM framework, the results-based management framework, is critical to build upon, to refine, to improve again. Very concrete recommendations from the external evaluation and the auditors. We will update that. And as we look at that, a specific component will be developing a theory of change. You heard the director saying that this point about how do we reflect what is that contribution from the Secretariat, while acknowledging that there's also a responsibility and accountability from member states. How do we show to you and our partners that our interventions do make a difference and contribute to improving the health outcomes? Methodologies such as strategic foresight to ensure that what we're projecting, to ensure that those target settings are indeed evidence-based, but also from the lessons and the experiences we have, that they are really realistic. But also, motivating to the change that needs to happen in the next 6 years so that we can move health forward towards where we need to see the improvements and accelerating and recovering where needed. We will, as mentioned already, incorporate, we are considering this inclusive and consultative process, as noted, again, beyond member states, partners, collaborating centers, the non-state actors, they are critical, as you mentioned in the last item. Anybody who needs to be involved so that this plan can really be informed by the input from partners as well. Streamlining the planning at country level, as I mentioned before, strategic input from your member states to define what is it that you need from PAHOs at country level, but also the collective priorities eventually aggregated to the regional level. At the same time, as it's required, every strategic plan will look at our budget policy. So we will need to revise the budget policy. As we speak, we're conducting an external evaluation of the current budget policy. The budget policy has two key aspects that are important: country focus. How much of and we are the only region that has a budget policy, let me also note that determines the allocation to country level. and also the issue of the key countries, the priority countries. Where is it that collectively, which countries need the most so that we also honor this commitment of addressing the inequities but leaving no one behind in action? I would like to end by just saying again that we appreciate this commitment from the beginning. We are even more motivated when we see the enthusiasm from last week's interventions from member states, and I'm sure through your good guidance here in this committee, we will continue to refine this roadmap, and most importantly, the content that will be required in this strategic agenda that will guide our cooperation for the next 6 years. With that, I thank you very much, and I would just like to say that when we think about the next 6 years, we need to think about the future of the new generation as well, and that those faces that we see there smiling, indeed will have a better chance at enjoying more optimal health and well-being. With that, I thank you very much, and I look forward to your comments and questions.
Muchas gracias.
Thank you very much, Mr. Ronnie Massa. The Executive Committee is invited to provide comments and recommendations on the proposed process for developing the PAHO Strategic Plan 2026-2031, and I will now open the floor to the plenary for discussion. I give the floor to the U.S.
We appreciate the informational document on the roadmap for developing the strategic actions plan of the Pan American Health Organization over the course of 2026-2031. We certainly anticipate actively participating in the consultation and prioritization process. In addition to the strategic input from member states, we encourage PAHO, of course, to include and seek input from all relevant stakeholders. And finally, we certainly look forward to learning more about those financial costs and those implications as the roadmap is developed. Thank you.
Muchas gracias.
Thank you very much to the U.S., and now I give the floor to Canada.
Thank you, Madam President. Canada thanks the Secretariat for sharing the proposed process for the development of this new strategic plan. We view PAHO's strategic plan as the most important operational planning tool for the organization, setting the direction that PAHO, member states, and partners need to take to support priority regional health efforts. As such, defining a participatory, transparent, and robust process is critical to facilitating development of a strong strategic plan. In this regard, we strongly support PAHO's efforts to incorporate best practices in strategic planning and results-based management, as well as lessons learned from the current strategic plan and recent WHO GPW process, including the importance of increased consultations with relevant stakeholders. We also note the report recognizes the need for flexibility within the new strategic plan to accommodate major changes in the situation or contexts and priorities during the period covered, for which we fully agree. To support this process, we strongly urge that clear criteria be set for the rationale and context of if and when to revise the plan to ensure changes are truly necessary and to safeguard this development process and what is collectively agreed to when the plan is adopted next year. Finally, Canada looks forward to actively participating in this important process with an aim to ensure this new plan is indeed strategic and feasible and truly leverages PAHO's value add in the region. Thank you.
Muchas gracias.
Thank you very much, Canada. I now recognize Jamaica.
Thank you, Madam President. The presented roadmap provides a comprehensive overview of the process to be undertaken by PAHO to develop its strategic plan for the period 2026 to 2031, and Jamaica appreciates the opportunity to provide comments and look forward to the continued collaboration and partnership in advancing universal health coverage and good health and well-being for all. Jamaica commends PAHO on the strengths of the plan, especially the explicit commitment to incorporate global and regional priorities in the strategic planning process, and the inclusion and involvement of member states along with stakeholders outside of health at critical junctures in development of the process. We, however, note the following considerations in the development process of the strategic plan. With the risk of a large-scale programmatic change, there is a need to ensure that the formal process to amend is not overly cumbersome, as this will limit the plan's responsiveness and agility. In concluding, Madam President, Jamaica reiterates its commendation to PAHO on the development of the roadmap. Thank you.
Thank you very much, Jamaica. I now call on Argentina. Thank you, Madam President. Argentina takes note and expresses its gratitude for the presentation of this document, the roadmap for developing the strategic plan of the Pan American Health Organization based on a process that includes the best planning practices as well as strategic practices and results-based strategy. We agree that for this process we will need the cooperation of all member states, technical teams of the Bureau, and other key stakeholders such as civil society, international organizations, cooperating centers, the academic community, and the private sector, as well as groups of young people. Our country will continue working within the framework of a Pan-Americanism on strategic issues of importance in the national public health agenda, as well as regional and international agendas such as digitalization of the health system, strengthening of supply chains, the fight against antimicrobial resistance, and the promotion of research and development in health, amongst others. Thank you, Madam President. Thank you very much, Argentina. And I will now give the floor to Chile.
Thank you, Madam President. The roadmap that's been proposed by this organization meets the requirements of the current health planning, which is results-based, including the participation of broad sectors in putting it together, along with the technical groups of each one of the member states who will do their part. Now, a big challenge we have to consider is, while crafting this plan, that we strengthen strategies to forge ahead in achieving those goals, which, according to the evaluation of the 2020-2025 plan, still seem far off. That's why it's going to be important for us to strike up in a consensus among the member states of this organization regarding the regional priorities, mindful of the necessary time to allow for it to be achieved. Now, Chile pledges to or has taken an active role in prior such activities at PAHO, offering the support of our healthcare ministry's teams for the development of this plan, which will also strengthen our capacities and competencies for everyone involved in this process. Chile backs this roadmap for developing the strategic plan of the Pan American Health Organization 2026-2030, which we view as being a key instrument for us to move ahead with the different, to guide forward the activities of this organization of member states in line with the region's priorities and those of each one of the countries. Thank you. Thank you, Chile. I give the floor to Uruguay. Thank you, Madam President. And I thank you also for this presentation. Uruguay would like to offer acknowledgement and thanks for this report, which defines the roadmap for the development of the strategic plan of the Pan American Health Organization from 26 to 31. Many of the comments that Uruguay wanted to raise have already been mentioned, but we still have some suggestions we would like to make. Now, if we look at the document, you see that the proposals made that are based on best practices and lessons learned from the prior plan offer a clear idea which will enable us to rise to the challenges and to make sure that they are also aligned with the Sustainable Development Goals and also the 2030 plan. Now, if we look at the three phases toward the end of the document, it seems like these are achievable time frames, This allows for a very broad participatory process, including not just the members, but also other important actors of society, the private sector, and other international organizations. As the report says, the participation of all of these different actors is not only possible, but it actually adds value. We especially stress the working strategy because this is going to help us to achieve the final goal, final product. Now, the plan should clearly reflect the needs detected by states and the organization locally. We need to think of strategies that aren't only regional but also sub-regional, because within each region there are differences, unique aspects that need to be borne in mind. Now, the Healthy Border Program and best practices should be considered as an example to be expanded throughout the region. Now, there are some priority areas that we should work on: non-communicable diseases, effective climate change on health, healthy aging, mental health, and strengthening the preparedness and response to pandemic emergencies. Uruguay reiterates its thanks for this report, and we reassert our commitment to closely collaborate in its implementation. Thank you.
Muchas gracias, Uruguay. Le concedo.
Thank you, Uruguay. I give the floor to Paraguay. Thank you, Madam President. Paraguay is also grateful for this document. We take note of it because it includes the good practices that are results-based for planning, and also it builds off of the prior plan. We think it's necessary for the strategic plan to be flexible enough to adapt to any change that takes place within the context of different countries and priorities as defined by them. So this plan should include a mechanism to make adjustments over time, especially when we bear in mind the SDG deadlines. Now, item 7 of this document, which proposes a review process with the active participation of member states. Now, regarding phase 2 of the process, which calls for an analysis and reaction, which will take nearly 7 months. On that, I should say that a timeline would help for countries to understand how they can take part in the definition of priorities, indicators, goals. All countries have to pull together to make this succeed, and that means there should be mechanisms ensuring full participation of all the different states and sectors. Thank you. Thank you, Paraguay. I give the floor to El Salvador.
Gracias.
Thank you, Madam President. El Salvador is grateful for this plan because we think it's going to enhance the health conditions of our populations in synergy with member states. We will actively take part in this process. All plans start with a diagnosis, and it's very important for us to identify the gaps, the most critical gaps that exist. And even more important than that is to understand the root causes that lead to these gaps, and that the plan zero in on resolving those root causes. This oftentimes means that we have to be creative, innovate, to break from paradigms. I make a call for the member states to focus on enhancing capacities. For example, HR management. It's important that people have the skills and knowledge and aptitudes, all of which are very important to transform healthcare systems. Something else that's very important is digital transformation as a catalyst, a potential tool to transform current healthcare systems, better financing as well, and we also have to make more efficient and optimize how we spend our health budget, that be done more efficiently. We need to focus on family and community. There are goals or challenges here, self-care, for example, but how do we bring about cultural change, healthy lifestyles, and non-communicable diseases, which are 80% of the diseases that lead to greater morbidity and mortality? We need to market health and use market psychology, bring that to bear. Private use tools that private companies use that we don't make full use of. So we also have to take these skills on, and also prioritized screening and prevention are important to avoid the complicated burden of diseases that many of us face. One of the important elements of this plan is the results-based focus, within which we have to consider not just the absence of disease, but also focusing on well-being. Lastly, we have to consider social determinants. If we improve health systems, with all of those improvements, that would give us a 10 to 20% improvement of the population's health. The rest is interaction with other sectors, social determinants. We have to work with other sectors, wager on these sectors for us to actually bring about greater benefits to health. Thank you, El Salvador. I give the floor back to Ronnie Massa. Thank you, Madam President. I would like to thank the 8 countries who have made comments, suggestions. U.S., Canada, Jamaica, Argentina, Chile, Uruguay, Paraguay, El Salvador. Thank you very much for your contributions, with which we can enhance this proposal. We take note of that and of your commitment, and we thank you also for your commitment to collaborate and contribute to the development of this strategic document, which is very important for this organization, to the member states and the Secretariat as well. I would like to address some points raised. I'll switch to English.
First of all, to the U.S. on the cost and the roadmap, we will provide details as we continue to communicate with member states, but just to note that we will get more to the costing when we get to the program budget as well, on the program budget proposal that we will bring to you next year. The first time you will see that. As we continue to build with you, and if there's any additional recommendations on what is needed, of course, we can have that discussion in the consultations that we will have. Just to note that we will have both regional consultations and one-on-one. So we are having to have the one-on-one consultation with member states. There is a process and a communication package that we're developing, the methodology, the templates. This was a point also that was highlighted last week in the first consultation that we had. And we are developing all those tools so that you will see how we will gather the input. Any additional details, of course, will come through that one-on-one and in the regional member states-wide consultations we will have. Another point that has come up is on the process to amend. Indeed, this is 3 member states, thank you, Canada, Jamaica, and Paraguay. This has been based on a lesson. You know, during the pandemic, there was a major shock, and the current strategic plan continued. And the lesson is we cannot be so, while we need to have a strategic plan that sees that vision, if something major happens in good planning practices, we should be able to adjust it, of course. And thank you for that, again, highlighting the clear criteria, a rigorous process, not just for the sake of changing to meet a target, but rather that it remains relevant and useful for where we need to go. If the situation has changed so much, we need to adjust, of course, the strategies. And to Chile on the strategies, on important indeed that we need to look at the strategies on where we need to make changes as well. We need to adjust on where these interventions that the course of action has proven not to work, and where we need to see that there is a new way of doing it, and what we have learned also through innovation, through new developments that have occurred during and post-pandemic will be important. New context is important to consider in this regard. We will be looking into that as well. Sub-regional strategies, thank you, Uruguay, for bringing that up. This was also mentioned in the consultation. We will be looking into that and how it also contributes, because indeed, in the region, we have this experience as country, but also the sub-regional mechanisms on what they contribute on advancing the health agenda at that level. That was also highlighted, and we're going to be looking into how that is reflected going forward. Paraguay, the timeline, the details, we will communicate. We will have a detailed timeline. For now, you have this general roadmap, but as we engage in the next consultation with member states, you will be able to see the specific actions and again, the information that will help us to plan. One of the key points that was highlighted last week in the consultation member states was also on the need to plan this well, communicate well, set the times so that member states can participate meaningfully and not just to have the session. So we will be communicating that also as part of the package. Indeed, to El Salvador, not just looking at the gaps, but the root causes. This is an important consideration in the situation analysis. We will be looking at, indeed, why, not just the what, but the why is it that we continue to see the persistent situation, and why are we seeing the gaps, and how. Then the strategy is back to the point that Chile was making. So this is an important aspect in the considerations. And yes, back to what member states echoed, priorities. We cannot do everything. We need to be realistic here. While we want to be motivational, we also need to be realistic. And again, that we put what really is of importance to you, of where PAHO's technical cooperation makes a difference. An important point that always comes up in the consultations is the point about clarifying what is the PAHO strategic plan's purpose versus you have national plans, you have national development plans, you have national health strategies and plans. And here is the PAHO's technical cooperation that comes to help. And there are other actors, and we need to do that analysis to again identify what is it that PAHO brings that is critical to move forward the agenda. And our specific contribution, and as our director highlighted in the previous item on the assessment, is we will show through the revised results framework, but also theories of change on where you will see where the Secretariat will contribute to improving the health outcomes. Again, thank you very much. Looking forward to continued engagement, and we will be communicating further on the details. Muchas gracias, señora Presidenta.
Thank you, Madam President. Thank you, Mr. Ronnie Mas. I give the floor to the Director for his comments. Thank you, Madam President. I would like to apologize for not being able to be here for the whole meeting. I had asked the President to allow me to have a meeting with the European Commission to take a look at some of the projects we have in the region with them in preparation for the summit of 2025, the CELAC European Commission Summit. Now, comments on this strategic plan. I would just like to reassert that I do think it's going to be very important for all of the countries to take part in this process, to learn from lessons of the current strategic plan to not fall into the same problems of fragmentation, indicators, targets that are superimposed one upon the other, that without there being a clear idea of what the strategic priorities that the member states want us to be focused on. We're going to be continuing with the implementation of all the lessons learned during the pandemic, strengthening our response to health emergencies and preparedness, and also to overcome the negative impacts or fallout of the pandemic, and to get close to meeting the Sustainable Development Goals with equity, that is, transforming health systems, making them more resilient. So I think of all the discussions that we're going to hold in this consultation process, and with the contributions that you will all make, will enable us to reflect the regional priorities that countries actually want, that the countries believe that they and PAHO can concentrate on during this time frame, and for there to be alignment with the general work program of WHO, which is also very important to the extent possible. And I think that's going to be a very constructive process in which we will facilitate to the extent possible the involvement of member states, so that we can reach 2025 with a plan ready with a high degree of consensus for it to be approved, pointing toward where the organization should move during this time period. Thank you, Dr. Barbosa. And so the debate will be reflected in the final report. I give the floor to Maria Lu Valdez, who has a few announcements to make.
I'd like to inform, sorry, I need that. Thank you. I'd like to inform the plenary that the working group that is established to work on the text of the proposed resolution, PR1, Policy to Strengthen Health Sector Action on Climate Change with Equity in Health, will meet in Room C during the lunch break. All members are invited to participate. A light lunch will be served, and there will be interpretation in English and Spanish. Thank you all.
Muchas gracias, señora.
Thank you, Marilu Valdez. We will resume our discussions here at 2 o'clock.
Estimados, un anuncio de último momento. Vamos a retomar.
2:15. We resume at 2:15. Thank you.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Buenas. Hola, Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo, otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se le solicita a la voluntaria de salud y a la paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo, les damos charlas a las madres, como identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá,
Yo creo que voy a dejar de ser voluntaria. 9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llamo. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya está, es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándoles capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo, de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación, hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas, y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los pobladores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas. Y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de que poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas, que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a arenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países que desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más que los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de arenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So EMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that The validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, Yes. Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines. Countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes. More people receive preventative care and treatment. Reduced disease burden. Plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está?
Pues todo bien.
En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se le solicita a la voluntaria de salud y a la paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo, les damos charlas a las madres como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya está, es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso de apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar alguna de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una muy mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación. Hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas,
y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos de sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés y poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas, que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a arenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países que desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de arenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, yes. Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Buenas. Hola Elsa, ¿qué tal está? De entrada está mami adentro, pero primero estamos a tomar la presión.
¿Qué tal está?
Pues todo bien.
En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica sectorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ellas se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se le solicita a la voluntaria de salud y a la paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo, les damos charlas a las madres como identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo Desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora. 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer eso.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una muy mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación, hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas, y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas, que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y arenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a arenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países que desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de arenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together.
Bueno, muy buenas tardes a todos.
Good afternoon, everyone. I hope that you enjoyed your lunch, and I hope that the meetings held went well. We're ready to begin with our afternoon session, and we're going to go to item 7.5, Plan of Action on the Sustainability of Measles, Rubella, and Congenital Rubella Syndrome Elimination in the Americas 2018-2023 Final Report. I bring to the attention of the committee document CE 174/INF-5 to the attention of the committee, and I invite Dr. Daniel Salas Peraza, Executive Manager of the Special Program on Comprehensive Immunization of the Bureau. Please come to the head table and present this item. Thank you very much, Madam President, Director, representatives of the member states, delegates, ladies and gentlemen. This document, Plan of Action for the Sustainability of Measles, Rubella, and Congenital Rubella Syndrome Elimination in the Americas 2018-2023 Final Report, presents the results of the efforts in the region of the Americas to sustain the elimination of these diseases in the period determined. This was the first region to eliminate measles, rubella, and congenital rubella syndrome. However, the status of elimination of measles was lost in 2018 because of outbreaks that occurred during 12 months in 2 member states. Since then, work has been done to recover that status and to verify for Venezuela elimination. Brazil is still pending, and the idea is that it will be re-verified in 2024. During the period under evaluation, 4 strategic lines of action were implemented: guaranteeing universal access to vaccines, strengthening epidemiological surveillance, developing national capacity, and establish rapid response mechanisms to outbreaks. There were 12 different indicators evaluated. 5 were complied with, 1 was complied with partially, and 6 did not reach the established goals because of the negative impact of COVID-19 in terms of vaccination and epidemiological surveillance. Despite this, in the last 2 years, we see that there are signs of recovery thanks to figures obtained. The indicators refer to the mandate of setting up national committees for the sustainability of the elimination of endemic transmission of measles, rubella, and congenital rubella syndrome, and presentation of annual reports. All countries that needed to deploy rapid response teams to interrupt potential transmission, and all of the countries with measles outbreak used a rapid response to outbreak teams, and also this avoided retransmission in 16 countries during the period. The indicator partially obtained has to do with the fact that 9 of the target countries reached the established rate, and there were 2 cases per 100,000 of suspicion of measles and rubella. For the regular vaccination schedule, 9 of the countries that comply with the objectives reached that goal, and they had a 95% coverage rate in terms of the first dose of measles, mumps, and other indicators not reached were at least 80% of the municipalities with a coverage of 95% or higher for the first dose of the triple vaccine, and in this case only 1 was complied with. Now, coverage of 95% in follow-up campaigns for the countries needing this in the period under evaluation, 8 out of 16 countries carried out campaigns and reached the goal of coverage. This report shows the adverse effect caused by the pandemic, and this shows that it's important to have financial resources so as to have resilient healthcare systems in normal situations and to follow the recommendations of outside experts. To maintain the elimination of these diseases in the region, we recommend implementing national vaccine campaigns periodically and reinforcing systematic vaccination as well as epidemic surveillance and improving response to imported outbreaks. Now, despite the challenges, the region of the Americas has maintained the elimination of rubella and congenital rubella syndrome since 2015 and made good headway in terms of eliminating measles in most of the countries. Now, it is important to point out that ongoing efforts are required and the necessary resources are important to consolidate accomplishments by increasing surveillance, and all of this in alignment with the resolution adopted in 2021, which is working towards universal health and looking at possibilities of elimination to assure sustainability in the short, medium, and long term, considering that for 2024, there has been an increase in transmission of measles in different parts of the world. Was that okay? Thank you very much, Madam President. Thank you. Thank you, Dr. Salas Pedaza. The Executive Committee is invited to take note of this report and make any comments it deems pertinent. I recognize the plenary for discussion. Uruguay has the floor.
Para el Uruguay
Uruguay wants to express its appreciation for the work done as reflected in this plan of action. In November of 2023, during the annual meeting of the Regional Commission for Monitoring and Verification of Elimination of Measles, Rubella, and Congenital Rubella Syndrome, it was found that there was no endemic circulation in the region of rubella or congenital rubella. We appreciate the accomplishments attained, and it's important to consolidate these objectives. Uruguay, along with its neighbors in the Americas, is committed to continue to work on epidemiological surveillance and vaccination campaigns, assuring the levels attained. Now, Uruguay wants to talk about the key areas where we need to focus our efforts. First of all, we have to deal with vaccine hesitancy. This is a frequent problem that we can mitigate by getting quality information on the population. Education is essential to eliminate myths and to provide verified information so as to strengthen trust in vaccines. Second, we need to have good coordination with migratory policy at the national governmental level. It is important that migrants be able to obtain health documentation and to be able to be vaccinated in an inclusive framework so that vulnerable populations will receive the necessary protection. Third, it is important to train vaccination staff in terms of changes in doses that avoids any error and provides for a smooth transition, making sure that vaccinations are given on a timely basis. Fourth, safe and effective vaccination require no interruptions in stocking and good cold storage. This is important. A robust system of inventory management and maintaining the cold chain is essential to maintain the effectiveness of vaccines. And lastly, it is essential to plan campaigns in the region. We need to have material and human resources available so that the necessary financial resources are available to sustain these activities all year. Working together in these areas, we can strengthen our vaccination programs, protect our communities, and move into a more healthy future. Thank you. Thank you, Uruguay. I recognize Jamaica.
Thank you, Madam President. Jamaica wishes to thank the Executive Committee for providing the report on the plan of action for the sustainability of measles, rubella, and congenital rubella syndrome elimination in the Americas. While achievement of 5 targets is commendable, there is concern with respect to ongoing gaps in attaining high and homogeneous vaccination coverage, as well as high-quality epidemiological surveillance. As vaccine hesitancy continues to affect the demand for vaccines, multi-sectoral collaboration, including health, including education and the private sector, are required to intensify social mobilization, communication, and promotion to drive demand generation toward achieving desired coverage and to drive demand generation toward achieving desired coverage outcome. Jamaica aligns itself with the actions prescribed in the document and specifically urged PAHO to intensify country support for the implementation strategies such as risk communication and community engagement to address vaccine hesitancy in the face of a new generation that has not experienced the ravages of measles and rubella outbreaks on our children for decades. Jamaica has made significant strides in closing the immunization gaps that had worsened due to the negative effects of COVID-19. This we have achieved through the implementation of a national catch-up campaign. While coverage rates for MMR vaccination have improved, there is still work to be done to ensure at least 95% of children under 2 years receive their dose on time. Paper-based information systems have proven to be a challenge for the effective and efficient monitoring and management of our vaccination program. In this regard, Jamaica has embarked on an ambitious plan for the implementation of the electronic immunization registry. We have already incorporated some of the lessons learned from our study tour to Uruguay and have updated the technical specifications document for the software that will be launched, the procurement that will be launched in July. We wish to again thank the government of Uruguay, as well as the government and people of Canada, who are supporting this investment through the Can Give intervention, where some $2.5 million have been committed to the strengthening of the MMR program and the routine immunization in general. Jamaica welcomes ongoing technical cooperation to strengthen regulatory and policy framework, health systems, and targeted interventions. Thank you.
Thank you very much, Jamaica. I now offer the floor to the United States.
Thank you, Madam President. The United States is committed to eliminating measles, rubella, and congenital rubella syndrome in the Americas and worldwide. Elimination of these diseases will save countless children from death and disability. To eliminate measles, rubella, and congenital rubella syndrome, we must strengthen access to routine childhood vaccinations that prevent these diseases, especially those living in communities with the least access to health services. There are 4 critical actions needed to sustain elimination of measles, rubella, and congenital rubella syndrome in the Americas. First, universal access to measles and rubella vaccination to all in routine vaccination programs. Second, a robust disease surveillance system. Third, develop and increase outbreak response capacity to prevent the reestablishment of endemic transmission in the Americas. And fourth, develop national operational capacity in the region to maintain measles and rubella elimination. The United States remains very concerned about the region's loss of measles-free status in 2018. The Americas continues to see an increase of measles as a result of virus importation from other regions. Therefore, the United States agrees with the conclusions in this report and highly recommend the implementation of its recommendations to sustain elimination efforts in the region. Thank you, Madam President.
Thank you very much, United States. I now give the floor to Dr. Salas Peraza to respond to the comments. Thank you, Madam President. We're enormously grateful to the countries, Uruguay, Jamaica, United States, for their comments. Uruguay, we concur entirely with the points of concern and issues mentioned, and we believe it is necessary to address vaccine hesitancy and continue training staff whenever there are changes to the scheme.
We commend you for the efforts on having and strengthen our operative information system for vaccinations. We have been given close follow-up to that, and of course you can count on us to continue working on that. And of course, we are aware that risk communication, that the topic of hesitancy must be really a proactive solution by really engaging communities. I think communication at the community level is very important to understand what are the perceptions, what are the things that people are thinking, and how can we really educate them about immunization. And to the USA, we are totally in agreement with your 4 critical actions mentioned, and also commend you for your commitment to continue this elimination of these important diseases. So thank you very much.
Muchas gracias, doctor.
Thank you very much, Dr. Salas Peraza. Let me offer the floor to the director, should he have any comments.
I first want to thank the member states for their comments, but also their commitment during this period that we had these 5 years that we had with this plan of actions. Let's remember that when this plan of action was approved in 2017, we were facing a very difficult situation in the region with transmission reestablished in 3 countries, but the US could stop the transmission before the period of 12 months. It was good, but 2 countries couldn't achieve this, Brazil and Venezuela. So these 2 countries, they lost their certification, and also the region as a whole. But at the same year, we started working together in Venezuela, for instance, and we need to thank all the donors, the stakeholders that came together, working with the Ministry of Health, but also with several NGOs. We achieved to vaccinate 80 million children in Venezuela, and this was crucial to stop the transmission. So now I also want to commend Brazil and Venezuela, because both Brazil probably, we are waiting the formal information from the committee, but Brazil now has completed 3 years with no case of measles, and strengthened their surveillance capacity. So we are almost 100% sure that Brazil will be recertificated, so we will again, as a region, to be considered free of measles. This is a very important achievement. I want to thank all the stakeholders that have worked with us, in particular the US CDC. That's a very important technical partner and supporter for the immunization activities in the region. But it's also very important to call the attention that the certification tell us about the past, because we can receive the certificate one day and the following month to have a case imported from Europe, from Asia, from Africa. In all other regions in the world, we have a very strong activity in many countries in the world. So it's, if by chance one person with measles coming to one city in Latin America, in the Caribbean, in US or Canada, it goes to a place where we have unvaccinated people, it can start again a transmission. So it's very important to strengthen both surveillance and at the same time to use the new tools that we have to identify where are the unvaccinated people in order to identify what are the barriers and to develop appropriate strategies. For this reason, it's very important to have the progress on establishing the electronic records for vaccination, routine immunization, so we can really identify what are the individuals that are receiving the vaccine. We can have the address, we can identify where they are. The old way, as I mentioned yesterday during another topic that we were discussing, the other way to have only administered doses, I think that is totally not capable to tell us what we need to do nowadays. So we need to support this movement to change the way that the national programs are getting data, are analyzing data, are identifying pockets of unvaccinated in order to address them. So the plan of action comes to an end, but not the work and the priority that you need to give to keeping measles, rubella, congenital and rubella syndrome eliminated in the Americas. I think that we are all very proud, and I want to commend all our countries for their continued support and hard work. It's not easy to eliminate a disease, but let's keep this hard work and guarantee that this time our status as the only region free of measles in the world can stay as a very important achievement for all countries in this region. Thank you, Madam President.
Thank you very much, Dr. Barbosa. I would like to inform the committee that the discussions will be noted in the final report. Let us now move on to agenda item 7.6, Plan of Action for Strengthening Information Systems for Health, 2019-2023 Final Report. I would like to bring document CE 174-INF/6 to the attention of the committee and invite Dr. Sebastián García Saizó, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to come to the head table and present the item. Madam President of the 174th Executive Committee, distinguished delegates of the Executive Committee, Director, colleagues. It's an honor to present the final report of the Plan of Action for Strengthening Information Systems for Health 2019-2023. A document that reflects progress and the challenges that we have faced when strengthening information systems for health in the region of the Americas. This report is the result of a collective effort involving all member states and key partners. Furthermore, it was the result of implementing the initiative known IES for H by the English acronym. During the period of execution of the plan, the organization and member states made a historical effort because for the very first time, an analysis of information system maturity was carried out in a standardized way based on international standards. This exercise was carried out over 240 standardized indicators to analyze processes and governance methods, national strategies, legislation, policy frameworks, financial sustainability, human resources, management and data quality, capacity for analysis, information flows, project management, and the technological infrastructure of the health sector, amongst other areas. The information underpinning this study was collected visiting countries, seeing specialists, analyzing data and gaps, reviewing policies, procedures, and technical documentation. The reported period showed significant strides for the region, framed by the 4 strategic objectives centered on improving management and governance of health information systems. The efforts carried out in the framework of these objectives resulted in substantial improvements in governance structure, maturity evaluation, and the integration of technologies at the forefront, which shows a strong regional commitment that is data-centered. With regard to Objective 1.1, strengthen the management and governance mechanism, there were important results with practically all the indicators exceeding targets. The key goals were establishment of governance mechanisms in 17 countries, extensive adoption of the maturity model of PAHO by 49 countries, and developing a regulatory framework supporting data interoperability in 9 countries. These achievements show significant strengthening of the structural bases that are needed for governance of information systems. As far as Objective 2.1, promote interconnected information systems that are interoperable. The actions to improve interoperability and connectivity of information systems also exceeded expectations. The advance include introduction of standards for data sharing between 17 countries, implementation of new standards for ICTs in 20 countries. However, complete implementation of national systems for electronic health registry was not fully achieved. There is therefore a need to continue focusing to achieve greater digital integration. Objective 3.1, improve the knowledge. There was sharing of best practices between more than 10 countries, something that was pointed out by the delegate of Jamaica when talking about the study mission carried out in Uruguay. It also includes renewal of the Relaxis network to promote adoption of information systems and digital health initiatives, showing firm commitment to optimize technological infrastructure and digital transformation of the health sector. In this point, we want to especially acknowledge United States and USAID that has been supporting this network for the past 10 years. Lastly, Objective 4.1, encourage convergence and intelligence. Important strides were made to integrate innovative methodologies in the health sector. A network of 32 countries was created to facilitate digital transformation, and a standard set of indicators were adopted for monitoring and evaluation of information systems in more than 17 countries. Participation in e-government initiatives was quite notable. 20 countries formalized the participation of the health sector, improving integration and efficiency in managing data and setting firm bases to achieve digital transformation. Amongst lessons learned from this period, well, we learned the importance of having solid mechanisms for governance with updated regulatory frameworks to improve data management. Furthermore, recognizing interoperability and standardization of information systems are crucial elements for the success of digital transformation. Active participation by academic and professional institutions proved to be vital to strengthen the technical capacities and knowledge management. Furthermore, the need for a focus that is person-centered and focusing also on equity has been constant. It's important to ensure that technologies and information systems are accessible and benefit all populations, in particular the most vulnerable. With a forward look, we want to have a multi-sectoral, interdisciplinary approach to promote the adoption of international standards for data and interoperability of platforms, elements considered in the renewed Plan 2024-2030 that we mentioned a few days ago. It will also be crucial to strengthen the technological infrastructure and guarantee ongoing training in digital skills for health professionals. Establish solid protocols for privacy and data safety and security, and encourage cooperation between governments, private sector, and academia to create a solid digital health structure. The evaluation of platforms, including new technologies such as AI, is occurring throughout the region. It will therefore be important to ensure that the digital transformation is aligned with the national public health strategies to promote universal access and improve health services. Without further ado, let me invite the Executive Committee to note this report and to share whatever comments they deem are appropriate. Thank you very much, Madam President. Thank you very much, Dr. Garcia Saiso. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I would now open the floor to the plenary for discussion.
Muy bien, no hay comentarios.
No comments. Is there anything you'd like to add, or Mr. Director? Yes, thank you. Thank you, Madam President. This is, again, a very important topic. And here again, our region is a world leader. This initiative of strengthening information systems for health began before 2019. The plan of action was approved, was important. There was a strong growth. We began with one partner, USAID. Today we have 11 partners who have joined the effort using the tool that PAHO developed in order to have a maturity analysis. This tool today is recognized by the IDB and the World Bank. The countries in the region have already used $1.2 billion in loans through the IDBO and World Bank in order to strengthen their information systems for health, in particular to ensure the digital transformation in health and digital health. This is an excellent example, therefore, of an initiative that has made important strides and now ensures the transformation to react to the new priorities that the countries in the region are facing. Prior to the pandemic, nobody spoke about the digital transformation of the health sector. It was only the specialists. But during and post-pandemic, at all the bilaterals with ministers of health, the ministers started to put health digital transformation on their list of priorities. So this area of technical cooperation has been transformed. In the new agreement that I signed in March with the IDB's president, digital transformation of health is one of the cooperation sectors we have with the IDB. And in the Embassy of Brazil, and thank you very much, Brazil, for the excellent initiative of yesterday's event on primary health care, but Juan Pablo Uribe, the Global Health Care and Nutrition Manager for the World Bank, referred to the partnership with us and spoke about the health sector's digital transformation. So there have been many achievements under this plan of action. And now, based on the resolution that was approved for digital transformation, we will continue working with the countries, mobilizing additional sources, even non-traditional sources in the region. They are joining the effort, such as the Agency of Cooperation of Germany. There was a meeting last year with the ministry in Germany also, as well as the cooperation agency. And sometimes I joke around saying that part of my work is the publicity to draw attention for Latin America and the Caribbean, showing that we need involvement of additional partners. So we now have the agency in Spain also involved. And they are focusing on the vaccine immunization registers, and especially when there's no internet connection, when it's offline, border regions. So they want to generate knowledge and platforms that can be used in other countries. This is an area where there have been many achievements, but we have to continue mobilizing more and more partners and stakeholders to continue supporting countries in this very important area. Thank you, Madam President. Thank you, Dr. Jarbas Barbosa. I inform the committee that the discussion will be reflected in the final report. Very well, moving on with our work agenda. We now go to agenda item 7.7, Plan of Action on Human Rights for Universal Access to Health and Universal Health Coverage, 2018-2023, final report. I would like to bring document CE 174-INF7 to the attention of the committee and invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table and present the item.
Madam President of the 174th Executive Committee, delegates to the Executive Committee, Director Dr. Barbosa. A well-qualified, trained and distributed health workforce is essential to achieving universal access to health and universal health coverage in the Americas, as well as health systems that are resilient to public health emergencies, natural disasters and climate change. In 2018, the 56th PAHO Directing Council adopted the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage, with 3 strategic lines of action, 10 objectives and 21 indicators. This to address the issues of health workforce identified by Member States during the development of that plan. In 2023, the 60th PAHO Directing Council adopted the Policy on Health Workforce 2030, strengthening human resources for health to achieve resilient health systems, which underline the main challenges posed by the Plan of Action and reflect the key lessons learned during the COVID-19 pandemic in health workforce issues. The final report under consideration today notes that the targets were not met for most of the indicators of the Plan of Action. It is important, however, to consider the impact of the COVID-19 pandemic on implementation of the Plan of Action. During most of the period of this plan, Member States were required to focus their attention on the response to the health emergency. And even as health workforce actions constituted an essential factor in the response, Member States were limited in their capacity to achieve objectives and indicators of the plan of action. This was especially notable in more structural areas of work of the plan. For example, in issues relating to stewardship and governance of the health workforce, in longer-term financing mechanisms required to recruit and retain health workers, in processes for accreditation and evaluation of quality, and the development of regulatory mechanisms for the training of health workers at all levels of the system. Notwithstanding, the report also highlights some important advances during the period, especially in health workforce policies development and adoption, in the mobilisation of the health workforce against COVID-19, and in strengthening of information systems, in national dialogues on health workforce migration, in the implementation of continuing education plans, and the evaluation of health education in the region. The final report highlights lessons learned from the implementation of the Plan of Action, and it proposes actions that are in line with the policy document that was adopted in 2030 by the Directing Council. The document on Health Workforce 2030 that was adopted by the Directing Council in 2023. It highlights the need to continue to work towards the achievement of objectives and targets in the Plan of Action, and in particular to strengthen governance, stewardship and leadership capacities in areas of health workforce. Madam President, the Secretariat would like to thank Member States for the information provided and consolidated in this report and for their participation in the preparation of it. Thank you.
Thank you very much, Dr. Fitzgerald. The Executive Committee is invited to note this report and provide any comments it deems pertinent. So I now open the floor to the plenary to begin this discussion. Jamaica, you have the floor.
Thank you, Madam President. Jamaica commends the collective efforts of the implementation of the Plan of Action on Human Resource for Universal Access to Health and Universal Health Coverage 2018-2023. Despite the challenges posed by COVID-19, significant progress has been made, demonstrating our shared commitment and resilience. Jamaica must point out, however, the challenge of health worker migration and the impact that this issue is having on the delivery of health service and how this might compromise the achievement of universal health access. Jamaica again asks that PAHO use its considerable social capital to bring to the table the sending and receiving countries so that a coordinated and sustainable plan can be developed to address the massive brain drain that is affecting us in the Caribbean. As evidence of this, last year alone, Jamaica lost over 400 nurses, including specialist nurses, due to migration. We cannot sustain our health system effectively with this level of movement. We therefore ask that PAHO, as a matter of urgency, look at feasible and sustainable strategies to meet the needs based on the issues of demand and supply that affect all governments. Further, Jamaica acknowledges the achievement that to achieve universal health coverage, sustained efforts are required. We believe the final report offers valuable insights for future action. Consequently, we suggest the strengthening of the data collection and analysis on human resource needs across all member states to make better targeting of interventions and ensure equitable distribution of healthcare workers. To conclude, Madam President, Jamaica notes the report, requests the affirmation of the commitment to strengthen our health workforce as a backbone of our health system and encourage us together strive to attain universal health coverage for all in the Americas. Thank you.
Thank you very much, Jamaica. I now offer the floor to Brazil. Thank you, Madam President. The presentation of this report is a matter of concern to us. The labor force in health is a central issue of our efforts to build resilient health systems, which means that in order to confront a new international emergency of international interest should one arise. We are not getting close to the target at the speed or in the way that we think would be necessary. It is worthwhile that we make additional efforts to revitalize this discussion among the countries of the Americas. In a similar way to what we did last year when talking about the health sector, what we would like to table is the offer to have a meeting of the Americas next year that we could host, looking at the implementation of the Plan of Action on Human Resources, should that be deemed desirable. Thank you very much. Thank you very much, Brazil. I now offer the floor to El Salvador. Thank you, Madam President. We support the plan as implemented, given that human resources are the cornerstone for our organizations. Health and health resource is vital for the system. There are different components. We've got the number, sufficient human resources, in other words, and their quality also. Speaking about the number, we need to have the appropriate diagnosis, not only of how many crew, but how many staff, and also the hours and the distribution that it is fair throughout the country. There is a tendency to centralize in the capital cities or large urban spaces, but there are many areas that are devoid of staffing. The migration of human resources to other countries also, because they see greater possibilities. But then there's also the quality of human resources, the development of skills. We're always talking about knowledge, skills, and attitude, because frequently they have a more technical or biological perception of medicine without thinking about another important element, and that is treatment, empathy, emotional management, how we communicate with patients. And this is often one of the complaints we hear in the hospital environment. I do believe that the exit profiles from academia, and we need to work with academia and do so strongly, because we need to work with these other sectors in order to convey and express what types of profile each of our countries needs to find in these people who graduate or come through their studies. What we have to say as the health system, because we receive staff without sometimes all the skills, and their curricula perhaps doesn't meet the actual requirements of the health system. So there's a hospital-centric type of preparation, but we forget about family medicine and the primary care capacities. We need to reconsider the skill of the professionals who are at the primary health care, because they take care of 80% of patients at the primary level. So this is an issue countries need to focus on. We want to work with those profiles, do so in an integral, standardized way in order to have better profiles, better skills. Thank you very much.
Muchas gracias, El Salvador. Le concedo la palabra.
Thank you, El Salvador. I recognize the United States.
President, the United States fully appreciates the final report on the region's efforts to advance the plan of action for human resources for universal health coverage, and really appreciates PAHO's work in this critical area. We also welcome the progress made in strengthening leadership and governance for human resources for health, as well as actions for capacity building and the partnerships with the educational sector to implement continuing education plans for health professionals. We continue to encourage PAHO to work on strategies to address, indeed, the migration of health workers, and ensure that through health system strengthening and human resources for health information systems, that these are certainly robust and that health workers have the right leadership and skills and capacities to respond to crisis. Member states can certainly continue to accelerate our collective progress towards universal health coverage by investing in essential health services. And of course, this includes human resources as well as sexual and reproductive health services. I welcome this meeting by our colleagues. Está muy bienvenida la propuesta de esta reunión.
So we welcome the proposal that was just voiced by Brazil.
And advancing this critical important item. Thank you so much, Madam President.
Muchas gracias, Estados Unidos.
Thank you, United States. I now call on Dr. Fitzgerald for him to respond to the comments.
And a special note of thanks to Jamaica, Brazil, and the United States and El Salvador for their comments and contributions on this very important report. As has been mentioned by you, the Member States, we have seen advances in some areas of implementation of the Plan of Action, particularly in regard to areas around more comprehensive national policy development around health workforce issues. And this really speaks to, I think, linkages between the strategy that was initially adopted in 2017 and also the more recent policy work that was adopted by the Directing Council last year. Closely linked with that is the development of some regulatory mechanisms around professional competencies, recognition of them, classification systems, quality, some work in accreditation that has advanced in the region during this time. It is to be really noted, however, I think it became very clear during the pandemic the critical importance of having a well-qualified, available and well-distributed health workforce because the actions and responses developed during the pandemic simply would not have been possible without having an adaptable workforce that we could shift from either the first or second level of care, maintaining essential health services, as the United States mentioned, into specialized tertiary care to be able to also to respond to the needs and to ensure the deployment of the various countermeasures that were required during the pandemic. And I think there was an enormous amount of recognition of the importance of the issue of health work during the pandemic that resulted also in discussions around the Summit of the Americas, the adoption of the Plan of Action in the OAS, and subsequent discussions around the prioritization of the health workforce issue within the region. Critical to this issue also was the issue of primary health care, and I think Jamaica really noted this in Jamaica's intervention. Again, some advances have been made around workforce issues and primary health care. We report that 11 countries have increased national budgetary allocations for health workforce at the first level of care. And this is really quite important. If we're really going to ensure that level of coverage and access of health services in remote and underserved areas, we need to be able to mobilize and ensure the availability of a qualified workforce in these areas, which is not an easy task because there is a natural internal migration process also within countries towards larger urban centres. And so it's good to see, I think, the report indicating that there has been significant financial allocations and increases in health workforce in more remote and underserved areas of the primary care level. The other area I think that really speaks to a comment made by the delegate from El Salvador is around the issue of competencies and the collective competencies required to address the comprehensive needs of persons and the community based on the conditions in which they're living, interprofessional teams. We have seen a significant growth in processes around the organisation, structure, and quality of interprofessional teams, particularly at the first level of care. Brazil has just increased significantly, not just the amount of interprofessional teams that are being allocated within the family health programme, but also the professions to be included in the interprofessional teams to be able to respond comprehensively to the needs. And we see a very important discussion around what competencies are required at the first level of care through the organisation of interprofessional teams. And a special note, I think, also speaking to the issue of qualification of primary health care, family medicine programs, specialisation in primary health care. We have seen also an uptick in the number of courses and processes of accreditation for family practitioners in the region. And 10 countries are now reporting that at least 30% of healthcare residencies are now in family and community health, which is a very positive sign for the region to increase access to comprehensive health services based on the primary healthcare strategy. That, I think, is the positive note that we can take out of the report, and is very much aligned also with the policy that was adopted last year in 2013. But I think there are a number of area concerns that have been highlighted by the member states here today that I think merit a few comments. While we see in the report that 16 countries have established mechanisms and processes to carry out health workforce planning, we note that only 9 countries have actually carried out and developed health workforce plans. That's 9 of 25 countries reporting. And so within a context in which countries are undertaking significant and substantive health sector reform processes based on primary health care, we see perhaps a disjoint between the processes of expansion of the health system, including, in many cases, substantive reorganization between the levels of care and the integration that needs to occur within them. We see a disjoint between that and the fundamental processes of health workforce planning. Many countries don't even have the information systems around which they know what workforce they have, where, and with what competencies. And so one of the key areas of the policy that was adopted last year was really around consolidating, first of all, information systems. And we've seen important advances in the development of information systems even over the past few years. 9 countries now are implementing the health workforce information systems that we're working with WHO Geneva on to begin to characterize and understand the health professions that they have, where they're located, what their competencies are, and where the gaps exist. So critically important if we're really going to reach and ensure access to health services, particularly in remote and underserved areas. And those information systems are so necessary then if countries are going to undertake a 1-year, 5-year, or 10-year health workforce strategy or plan that will be required to address some of the major challenges, not just with health systems expansion or the epidemiological transition or issues around long-term care that we discussed on the first day, but also to really address this critical issue. Many countries, particularly in the Caribbean, not just limited in the Caribbean, as was mentioned by the Honourable Delegate from Jamaica on health workforce migration. We estimate that there is essentially a shortage of about 1.2 million health workers if we're to achieve 80% of the service coverage index that has been defined by the SDG 3.8.1. That's by 2030. And what we're seeing in a number of countries, this issue is becoming even more complex by the outflow of health workers from countries into more well-resourced countries, either in North America or in Europe. And we recognize this, and we've been working very closely with Jamaica, with many of the smaller island developing nations in the Caribbean, with the support of funding from WHO to begin to characterize and develop the mitigation processes that will be required either to recruit or retain or either support countries in the negotiation of bilateral arrangements. The Director signed an agreement with Euro in the United States a year ago, covering a number of areas. And one of those areas is around health workforce retention and migration. And following that, the signing of that agreement, we are moving forward in the organization of a meeting with WHO Euro on the issue of health workforce migration that will bring together countries in Europe and from the region of the Americas to begin to discuss issues around health workforce migration and the flows and the agreements that are necessary to ensure that we are not depleting health systems in the Americas to the point that they cannot ensure the provision of essential health services. So that meeting will occur here in Washington in October of this year, and we will make sure to coordinate very closely with Jamaica, with the Caribbean, with other delegations on the organization of that meeting. I think a final comment, and our thanks to Brazil also. We've been working very closely in a real recognition of the leadership of Brazil through the G20 on bringing this issue to the forefront of G20 countries. Because within G20, actually, we see not just countries that may be at the behest of outflows of health workers, but also countries that are actually receiving those health workers. So we recognize the complexity of the discussion within G20. And it was very good to see under the leadership of Brazil really pushing forward the idea of countries reporting against, adhering to, and fully implementing the requirements of the WHO Code of Practice for the International Recruitment of Health Professionals. This, I think, really speaks to the leadership of Brazil in recognizing the fundamental importance of this reporting mechanism to ensure, first of all, that we are informed what is occurring in the flows of health workers between countries, and also to make sure that there is adherence to agreed aspects of the resolution within WHO. And so I think we will be very happy to work with Brazil on the organization of the meeting around more broadly the plan of action and perhaps the policy that was adopted last year. And of course, leading out from the discussions, whatever is adopted finally in G20, I think that would be extremely useful to have that. So I think this presents us a little bit of a roadmap moving forward. A final comment on the comments made by the Honourable Delegate of El Salvador, which really speaks to the issue of competencies. We often speak about the resolutive capacity of health services, particularly at the first level of care. And what we're really talking about is the capacity of the health workforce and the interprofessional teams to provide the care to address the needs based on the context of the health needs of the population. Critical to that is maintaining and ensuring continuing education of our health workforce. The PAHO Virtual Campus has been an important instrument, not just during the pandemic, where we saw a massive and exponential growth of health workers participating and taking courses in the PAHO Virtual Campus, but it has continued to expand at an enormous and phenomenal rate since then. And we now have over 3.3 million health workers actively engaged. Over 900,000 courses were delivered last year to health workers throughout the Americas through the campus. It's an amazing and a highly performative tool to reach health workers wherever they are. And now through the deployment of more advanced tools, through geospatial analysis, through the characterization of health workers, we're beginning to have a more fuller understanding of who is actually receiving these trainings. We see that 46% of those receiving trainings are working at the first level of care. And so the expansion of NCD through primary health care, the elimination agenda, social determinants of health, information, digital transformation, all these courses are being delivered to health workers directly at the front line to improve quality of care and to improve their competencies. The other 46% are actually working in the hospital environment. And so some of the more specialized courses, I think, in the campus are of particular relevance to them. In addition, we have health workers, public health workers, community health workers, and even public health managers that are now fully engaged. And so this has become a very important tool with the support, I think, of Spain. We have to really thank Spain and the United States for the funding for this funding that we've received in support of the virtual campus, and to continue that expansion as a strategic tool to reach health workers in the Americas. As a final note, we are concluding, I will say, that the PAHO Virtual Campus assumes the role of the regional hub of WHO Academy. And so as WHO Academy rolls out, the PAHO Virtual Campus will become the regional hub for the delivery of courses through WHO Academy into the Americas, of course adapted to the context of the region to really expand and increase capacity. So these are some of the actions that have been ongoing, but I think we have a huge work program ahead of us, and we really look forward to a more profound and frank discussion, I think, with our member states, with some member states in Europe, around the issue of health workforce mobility in October, and then leading into a discussion with Brazil next year on the broader implementation of the policy and plan of action. Thank you very much.
Muchas gracias, Dr. Fitz.
Thank you very much, Dr. Fitzgerald. Director, do you have any comments on this item?
Almost everything that is really important. First, to acknowledge and to commend the countries for their progress during the period of this plan of action. And at the same time, as James Fitzgerald highlighted, how important was also the adoption of the resolution last year. So we have a clear guidance about the priorities that we need to work with the countries to have better data, better information, better analysis, better planning of the healthy workforce that they have now, the gaps, and what are the measures, the appropriate measures to put in place in order to fulfill these gaps. I think that just to also to highlight, and I was this final comment from James about the virtual campus, how to highlight how important it is to have the virtual campus functioning. During the dengue fever outbreak, we had around 400,000 nurses and physicians that had their trainings, how to manage a clinical management on dengue fever. So this probably prevented the hundreds of deaths to happen in the region. So I think that it's really a very important tool to support the development of the healthcare workforce. We know how high is the rotation on primary healthcare, so probably the nurses and physicians that are now working at the primary healthcare, they were not there 8 or 10 years ago when the last outbreak happened in the country. So this was really important to use this tool. And finally, I think that is also very important, this offer, kind of offer from Brazil. And I think that this will be a very, very good moment to address all the different issues that we have. Jamaica, certainly you will be there, and we will coordinate to have a very good discussion about the migration, let's say, so policies to recruit and retain healthcare workforces. Minister Tufton and Jamaica delegation is always a very important champion, calling the attention for the shortage of nurses, mainly in many countries of the Caribbean, that are now a barrier not only to the expansion of primary healthcare, but also to keep the hospitals working properly, because they are not only nurses related to primary healthcare, but nurses that have some specialties that are now, we have shortage of them in many countries of the Caribbean. So this is really a thing that you need to address collectively. We know that this is a complex issue because people, they have the freedom to migrate, but what are the policies that you can put in place to preserving the freedom for migration, that no one can think about putting any barrier, but what are the measures that we need to put in place in order to replace this healthcare workforce, in order to strengthen their capacity. I think that yesterday, during that event that we had in many countries, I think one country was mentioned, but that was Uruguay, but this is not only Uruguay, that we really don't have the nurses and physicians ready to participate in this renewed and strengthened the primary health care that we are talking about, in order to make the primary health care level to resolve problems, to monitor, to offer diagnosis, treatment for non-communicable diseases, to reduce the unacceptable rates of pregnancy among adolescents that we have in our region, to foster the elimination of diseases. So we are really talking about the new needs, and the lessons that you learned during the pandemic told us clearly that the healthcare workforce is really important, and all the investments that you need to do, identifying what are the most important actions to be implemented in the region to support our member states. Thank you, Madam President.
Muchas gracias, doctor.
Thank you very much, Dr. Jarbas Barbosa. I inform that the discussions will be noted in the final report.
Unos breves avisos.
Just some minor announcements. We're going to take a coffee break right now, just a few minutes, and then we will come back to address the rest of our agenda. The final thing that will be discussed is the result of the negotiating meeting that was held earlier today. That will be discussed at the end of today's meeting. Thank you. Enjoy your coffee.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, Yes. Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Buenas. Hola, Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está?
Pues todo bien.
En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo, otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se le solicita a la voluntaria de salud y a la paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo, les damos charlas a las madres como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo Desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora. 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya está, es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer eso.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Muy buenas tardes a todos.
Good afternoon. Let's resume our work. Now we're going to go to item 7.8, access and rational use of strategic and high-cost medicines and other health technologies. Final report. I call the committee's attention to document CE 174/INF/8, and I invite Ms. Judith Rios San Juan, Director of the Department of Innovation, Access to Medicines and Health Technologies of the Pan American Sanitary Bureau, to come to the head table and present the item. Good afternoon, Madam President. Good afternoon, delegates and representatives of the Executive Committee. Director Barbosa, the purpose of this presentation is to present to you the final report regarding the implementation of two resolutions. Resolution on access to medications adopted in 2004, and that on the access and rational use of strategic high-cost medicines and other health technologies adopted in 2016. In this report, we will present progress made and challenges remaining for access and rational use of high-cost medicines and other health technologies in the proposed strategies. For the adoption of this report, the Secretariat sent in a questionnaire to the member states at the end of 2023, and I take this opportunity to thank all of the countries who offered their support and their knowledge to fill those questionnaires out. That information was complemented by technical cooperation experiences, complementary consultations with member states, and reviews of literature and public documents. Access, including challenges to medicines and other health technologies, especially strategic high-cost technologies, continues to be a crucial matter for the region. Now, regarding progress achieved in the period under analysis, the report underscores that the member states have progressed in the implementation of strategies and policies for access to health technologies at different levels of development and focus. Among those policies that have been developed and implemented or updated, there are national medication and medical device policies that relate to access to high-cost technologies, many of which are tied to prevention and control of oncological diseases as well as rare ones. Now, progress in the development of mechanisms for the improvement and the evaluation of health technology based on evidence are among the most important, especially those that have to do with practices that are matched with demand. We see progress regarding the use of consolidated purchases at the regional, sub-regional levels, as well as the revolving strategic funds of PAHO pooling. Now, the report also says that there still remain some challenges. We see the need to consolidate and to strengthen legal frameworks and public policies to enhance access to health technologies, especially the high-cost ones. Regarding prices, disparity among countries varies a lot, which is of concern regarding high-cost technologies. That's why to bring down these inequalities is very important for there to be equitable access throughout the region. Despite progress made in making use of the evaluation of health technologies, few countries manage to link the evaluation processes with the incorporation of decisions, as well as the necessary integration to promote the rational use and practice guides and monitoring, as well as competencies. Access to information remains a challenge, especially as regards transparency of costs throughout the development chain, their supply, and the repercussion this all has on the final price. Information available on public procurement is quite limited. Another challenge is in access to overall research and development costs, and as well as production cost structures and prices. COVID-19
laid bare the dependence of the region on imports of health technologies. That's why it's key for us to promote the ability to innovate and produce regionally to bring down these access gaps. Finally, pointed out here is a concern that has been expressed by a number of countries given the resort to courts, a problem that has taken on greater importance throughout the region. Among the necessary measures to address that situation and all the situations addressed to greater detail in the report, I would like to refer to progressing in development and strengthening public policies and frameworks for promoting access that be comprehensive and cut across sectors, including medications and other health technologies, bearing in mind the whole life cycle of these technologies. Strategic policies include the price regulation, the use of pooling procurement, as well as regional revolving funds, as well as strategies for the selection and the inclusion of health technologies that are evidence-based, promoting competencies, improving transparency and access to information, as well as spurring innovation and regional production, among others. Madam President, by way of conclusion, we would like to take this occasion to thank all of the member states that took part in these consultations to draft this report. PAHO will continue working with member states to improve and broaden access to health medicines and technologies, especially those which are of high cost or a priority, and to tackle the challenges that we still face in our region. Thank you. Thank you. Ruiz San Juan, we take note of this report, and I grant the floor, open the floor rather, for us to start this debate.
Brasil tiene la palabra.
Brazil has the floor.
Grazie, signora Presidente.
Thank you, Madam President.
For the final report on the implementation of this policy document. This issue remains of high importance to us, despite the difficulties we have and we know we have to make progress. Not only at PAHO have we been addressing it, as the director, Dr. James Fitzgerald, and has pointed out, we have been working on the forum like the G20. And at the G20 Health Working Group, we have put forward the establishment of a global alliance for global and regional production, innovation, and equity for access, focusing on vaccines, medicines, and diagnostic tools for neglected populations. The negotiations about this issue, about this proposal, are still ongoing. But the question that I would like to bring to the table is, how can we continue to make progress on this issue at PAHO? And I take the words of the presenter, who just said that the Secretariat will continue to work with member states. But and my question is, I'd like to invite us all to think out loud. Would a new policy document, a new resolution be envisageable? Should we envisage a revision of this resolution? Should we update it? Should we expand it? Should we work on it? Or if not, what other ways would we have in order to continue working? I know that it's not necessary to have a legal, a written document to keep on working on this issue, but to have a framework for our work would always be desirable. So I wonder if you have any reflections you could share on this issue. Thank you.
Thank you, Brazil. I grant the floor to Chile. Thank you very much, Madam President. Chile has made ongoing and intense use of joint procurement. That's why it seems to us that this proposal to strengthen this procedure is timely and unmarked. We have taken part in this strategy implemented by PAHO. The revolving and strategic funds have enabled us to have access to affordable prices in our region, and in addition to our ability to pay, this is a small portion of our market, but we do think that there is a need to forge ahead with this, to make use of medications that is to pool our purchasing ability for high-cost medicines. And when you look at the progress made over the last couple of years, especially in the area of medications for rare diseases, today in Chile, we are a bill of law has been presented to Congress to grant greater access to this type of medicine, but this tool might make a considerable contribution to this, ensure more affordable prices according to each country's ability to pay for medications, as well as vaccines that the population would be able to afford, have ready access to. We think both funds pooled in one is a great stride forward to open up access to products, health products in our region. Thank you very much. Thank you, Chile. I offer the floor to Ms. Ruiz San Juan for her comments. Thank you, Brazil and Chile, for your comments and suggestions. At PAHO, we are indeed committed to strengthening and innovating in our technical cooperation for this challenge, which is not only regional, it's worldwide. And this is an essential aspect that we wanted to stress, though it is a priority for all of the countries, as we have heard, and we do understand the prioritization as you've expressed. This is, however, a global challenge. Regional strategies beyond strengthening countries' abilities, these are the strategies that we are betting on by way of offering greater equity. We've learned a lot, not just from COVID-19, but those that have to do with access, which we are currently taking stock of and suffering from throughout the region. I would also like to stress that our technical cooperation goes beyond high-cost medicines. We understand that there are specific challenges regarding high-cost technologies, too, in which we want to enhance our cooperation and innovate. Now, key that is strengthening the regulatory framework and the development and implementation of assessment systems that are evidence-based to incorporate some of these technologies. We do understand that there are gaps in laws and policies in many countries of the region, which is one of the topics on which we want to focus. That is developing public policy, but also ensuring their implementation. Regarding the necessary measures, I would like to stress that in the report we have the matter of production and innovation in the region. I thank Brazil for its invitation. We have taken part in two of the working group meetings on health, that is PAHO has, and the proposal for the regional alliance on access and production regionally. We support that proposal because we believe that any efforts for overall regional and global and regional production are key, crucial, not just for high-cost diseases, but also as it has a strategic value. Something else that's key for strengthening this is the fact that there are many products that are produced in very few sources, and so transparency is something that's also on the agenda, a problem that has yet to be resolved in the region. So there are areas of analysis and further work that we need to bolster here at PAHO. These are strategies to promote competition, implementation of policies, as well as greater transparency. We do work closely with the funds. The proposals discussed yesterday are very germane to the discussion that we are holding here today, and adjustments, the adjustments you are making, that we are making here at PAHO, that is the two funds that work in a very integrated way to increase access to these technologies according to procurement strategies focus on products in the region, as well as enhancing competencies and also a critical eye on those technologies that we are or not including in the current portfolio. These are the matters with which we are working with countries. That is always in this assessment, evidence is key. These are all part of an ecosystem of activities. There is no one approach. I do think it's important that we strengthen all of them at the same time and try to further integrate them. Some of the work that we have done have been more reactive, focusing on access problems. For example, when certain products have received regulatory authorization in some countries and not in others, and so here at PAHO, one of the things we want to do is to be more proactive and look at the ecosystem of interventions that could be carried out during a technology's life cycle, including in the innovation processes by planning and seeking out strategies to ensure greater access in the investment and planning for R&D process to make sure that we're not only reacting when those technologies are already being introduced from elsewhere and our problem is one of access. These are just some of the points that I wanted to stress. In addition to recognizing that this is not a regional issue, it's a global one, we are making an effort to learn and to share with other regions. We know that PAHO is the only region that has a department created last year by Director Barbosa that coordinates and focuses on our innovation and technological development and access. No other counterpart regional organization has such a department. But we know that they are seeking out strategies to strengthen their cooperation. For example, the Euro region has a worthwhile initiative on strengthening access to novel technologies. We are cooperating with them to see what technical cooperation they are providing, how they're going about it, how we can strengthen our cooperation outside of the region. Much of our focus thus far has been on rare diseases and on some oncological diseases, but we do have a pipeline of health technologies coming into many of our countries, the problem of high access to high-cost products that goes beyond classifications, prioritizations, new antibiotics, for example, new products to prevent HIV, AIDS, diagnostics tools, the problem of access and of the high cost. That is a growing problem regionally and worldwide. So strategies can't only be integrated, that be far-reaching, ambitious to make sure that we can cover all of the needs of our public systems in the region. These are just some of my thoughts. By way of reaction to your comments, I would like to ask if the Director would like to complement. You have the floor, Mr. Director, if you would like to make any comments. Thank you, Madam President. I thank Brazil and Chile for those comments. Now, this policy document goes back to 2016, as we have just heard from Ms. Ruiz San Juan. This is a problem that's become ever more complex. At the same time, we have this good news, which are the new technologies and medicines that exist in the region and the world, which sometimes change completely our ability to address serious problems of cancers and other serious diseases. But at the same time, the challenge that many countries have also grows. The issue of the resort to courts to address these matters is, on the one hand, seeking to enhance access, but doing so in a disorganized way without doing an assessment of adopting technologies, without protocols, without understanding or actually opening up greater access to these new technologies and medicines by negotiating with the industry itself and resorting to other modes of financing. This has been done in a reactive way in response to these court orders or responding to industry sector pressures and of other groups. So as we've just heard, we have to look at the issue of strengthening local production in the region and in each one of the countries. We also have to look at how we can strengthen in each one of our countries the assessment of systems to bring on new technologies, which is an increasingly complex matter that calls for technical capacity. The country has to have that technical capacity to do this, and the very issue of access itself, to use PAHO funds to greater facilitate access. I won't take any more time. We are working with some countries in Mercosur, Chile, Argentina, Uruguay, and Paraguay. And when that proposal is ready, we would invite all of the countries that would like to join efforts to address a group of 5 diseases so that we can bring pressure to bear to bring down the cost of some of these medications, some of which there are producers for them in the region. So we need to come up with projects to strengthen local production on the one hand, to ensure access to all of the countries of the region. I think this is a virtuous circle that we can create that would be very worthwhile. So we spend a lot of time thinking about whether it's necessary to create a new resolution or not. But I do take Brazil's proposal seriously. Now, at the meeting of the Executive Committee that we are going to have immediately after the Directing Council about whether, well, if the agenda is approved, then we could hold an informal discussion among members of member states regarding whether we will be able to submit this proposal in 2025. Thank you very much. Thank you, Dr. Barbosa. I would like to report to the committee that the debate will be reflected in the final report.
Continuamos con el punto.
Let us move on to agenda item 7.9, progress reports on technical matters, sub-item A, addressing the causes of disparities in health services access and utilization for lesbian, gay, bisexual, and trans persons. Progress report. I would like to bring a document CE 174/INF/9A to the attention of the committee, and I invite Dr. Jerry Eikemans, Director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Sanitary Bureau, to please come up to the head table. The Executive Committee is invited to take note of this report and provide any comment it deems pertinent. I will now open the floor to the plenary for discussion.
Brasil, usted tiene la palabra.
Brazil has the floor. Thank you, Madam President. I apologize for asking for the floor so frequently. Very quickly, I simply wanted to welcome gladly the report that we've received. It seems to me that this is a very useful report because we don't have a lot of people that provide our delegations with an overarching information about the health of a population that is not visible in many countries in the region. So this is a useful exercise, and I would like to encourage the Secretariat to follow this up and to always provide us this information on a regular basis so that we can work on that information internally to the extent possible. I'm therefore very grateful to the Secretariat for this information. Thank you very much, Brazil. I now give the floor to Chile. We don't want to compete with Brazil. We couldn't do it. It's not within our possibilities. We wouldn't even dream of it. But just in case someone thought of it, I just wanted to clarify that. We have some opinions on some issues of those that have been brought to the attention of this meeting. We believe, and this is in connection with agenda item 7.9, that the document within the framework of the work that is carried out by the Ministry of Health of Chile contains all the background information and all the necessary recommendations in order to deal with the causes of the disparities that exist in Chile in connection with access and utilization of health services by lesbian, gay, homosexual, bisexual, and trans. We invite countries, we call on member countries of the organization to continue working on the recommendations proposed by this document, and we fully agree with these, and thus to be able to move forward on tracing indicators that will enable us to recognize gaps and progress that is made on this score. We believe that it is essential to look for strategies that will collect quantitative and qualitative information, including the quality of services that we're delivering to the people that need them, and that will enable us to have planning and decision-making on public health matters. Thank you very much, Madam President.
Gracias, Chile.
Thank you very much, Chile. I now give the floor to the U.S.
Muchísimas gracias. Los Estados Unidos agradece a la OPS por.
Thank you very much. The U.S. thanks PAHO for the progress made in order to deal and to address the causes of disparities in access and utilization of health services for lesbian, gay, bisexual, and trans persons. We are still committed to the reinstatement and the promotion of human rights, as also we do with all people. These commitments include the rights within the United States, but also all over the world. Aside from the sexual orientation or gender identity, all persons ought to be safe from violence and to be able to access and to receive health services, to be able to protect themselves and their HIV partners, as well as other sexually transmitted diseases. A little has been said about the criminalizing laws that stigmatize these acts. And these behaviors, or the sexual identity of LGBTQ plus people, result in more diseases and less health in general. The U.S. will continue looking to put an end to violence, to harassment, and to discrimination because of sexual orientation, gender identity, or gender expression situations, or also because of sexual characteristics and the criminalization of HIV. We would like to thank PAHO for this report that is brought to our attention on the progress that identifies the progress and the continuous barriers faced by LGBTQ plus people in the region, and all those actions that have been recommended in order to deal with these inequities in access to health services. Thank you very much, Madam President.
Muchas gracias.
Thank you very much, the U.S. And now I give the floor to Canada.
Thank you, Madam President. Canada commends the United States initiative in bringing forward this agenda item during the last year's Executive Committee meeting. The promotion and protection of the human rights of two-spirit, lesbian, gay, bisexual, trans, queer, and intersex persons is a domestic and foreign policy priority for Canada. We recognize PAHO's efforts in continuing to advance and monitor progress on this critical issue in the region, and we acknowledge the persistent challenges that exist. Canada remains committed to working with PAHO and the region to advance efforts to address and eliminate these barriers. Thank you.
Muchas gracias.
Thank you very much, Canada. I now recognize Dr. Eijkemans to respond to the comments.
Thank you very much, colleagues from Brazil, Chile, the US, Canada, for your supportive interventions, and thank you all for receiving this report positively and approving this progress report on the resolution addressing the causes of disparities in health service access and utilization of lesbian, gay, bisexual and trans persons. And this is, as you know, a document, resolution that was adopted already in 2013. And as was mentioned, it was prepared at the request of the US. Thank you very much. And it takes into account also the recommendations that were made in the 2018 progress report. The current report shows that there is progress. There's progress in the areas such as HIV policies, legislation, programs, and increased awareness. But many challenges remain. Now, as already been mentioned by several, lesbian, gay, bisexual and trans people throughout the Americas keep facing stigma and discrimination in the health sector, which creates obstacles for LGBT people to realize their right to health, thus exacerbating health inequities and hindering the achievement of universal health in the region. Also, the application and enforcement of anti-discrimination laws is uneven across the region, and data, which was also highlighted by several of you, on sexual orientation and gender identity is rarely collected, except, again, in the HIV services. These are just some of the remaining challenges. PAHO will continue to work and to support member states in the implementation of this resolution, to move forward and to improve access to care and the overall health indicators of the LGBT populations. And of course, we will keep informing our member states on progress that is being made. Thank you very much for your support.
Muchas gracias.
Thank you very much. Dr. Jarbas Barbosa, do you have the floor?
Madam President, I think that first I want to thank the comments made by our member states, but also the commitment. It's a progress report, so we are in the, let's say, in the middle of the way. Some very important progress have been made in recent years in the region, but we are still dealing with many important challenges. We still needed to think how we can using a human rights-based approach to guarantee that these groups that live in very difficult situation of vulnerability, and we have many indicators showing that the totally unacceptable rates of violence against trans persons, for instance, in many countries in our region, the cultural barriers that these groups face when they need access to a healthcare facility, the lack of access for treatments, diagnoses, the fear that sometimes they live to be criminalized. So we are still facing many challenges, but I do believe that sharing best practices that we have in the region and the Pan American Health Organization will continue working with our member states to advance this very important agenda. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Barbosa. I would like to inform the committee that the discussions will be reflected in the final report. Let us now move on with item 7.9, progress reports on technical matters, capital B, Roadmap for the Digital Transformation of the Health Sector in the Region of the Americas Progress Report. And I'd like to draw the attention of the committee to C-174 9B. That is a document that I call on Dr. Sebastián García Saizó, Director of the Department of Evidence Intelligence for Action in Health of the Pan American Sanitary Bureau, to please come up to that table. The Executive Committee is invited to take note of the report and provide any comments it deems pertinent. I will now open the floor to the plenary for discussion.
Argentina tiene la palabra.
Argentina is recognized. Thank you, Madam President. Argentina expresses its gratitude for this report on the roadmap for the digital transformation of the health sector. We agree in saying that these are vital in order to have access to health care and to continuity with health care. We would like to stress that the aspects of interoperability and artificial intelligence. It is along these lines that we're happy to hear that some countries have created national standardization information system committees and that we foster interoperability, semantic interoperability. In connection with artificial intelligence, it is essential to exchange experiences and participate in exploratory meetings to learn more about the role of AI in public health. Likewise, our country established the Latin American and Caribbean Network in order to strengthen health information systems or RELAXes, with the overall objective of contributing to strengthening health information systems and the use and dissemination of information. Thank you very much, Madam President.
Muchas gracias,
Thank you very much, Argentina. And now I give the floor to Canada.
Thank you, Madam President. Canada remains supportive of regional efforts towards improving digital health and welcomes this update on the region's efforts in advancing the roadmap for digital transformation of the health sector in the Americas. We particularly appreciate that the report considers critical aspects of digital transformation, such as equity and inclusivity, as well as interoperability. Canada views equity and inclusivity as key aspects in the efforts required to ensure that the benefits of digitization and virtualization of healthcare systems leave no one behind. In this context, Canada wants to highlight the need to advance digital health literacy, strengthen gender disaggregated data collection, address the gender-digital divide, strengthen health equity and primary health care and community-based approaches. In this regard, we are committed to working with First Nations, Inuit, and Métis partners in Canada to co-develop distinctions-based Indigenous health legislation to improve access to high-quality, culturally relevant health services. Further, we welcome the reference to exploring new opportunities for development of primary health care within the new Alliance for Primary Health Care in the Americas by PAHO, IDB, and the World Bank. Canada looks forward to seeing how this important initiative continues to progress. Thank you.
Muchas gracias.
Thank you very much, Canada. And now I call on El Salvador. Thank you, Madam President. El Salvador welcomes the roadmap for the digital transformation of the health sector. Our country made significant progress in digital transformation in the country and the health sector, aligning the effort with PAHO objectives. I worked with strategic partners, precisely with PAHO, the IDB, the World Bank, developing a digital path as such. We adopted a model that is known the digital home that has the basic components for the development of all necessary conditions for the required quality leap, including governance and other mechanisms. We've strengthened terminals, servers, in all health establishments, developing a very robust IT system known as Integrated Health System through a team of developers. In universal connectivity, we've achieved to close the digital gap. 100% of all health establishments has access to high-speed internet, where we collect all the actions aimed at providing care to patients and allowing to practice a comprehensive health practice. Regarding interoperability, we've matured infrastructure, international classifications, and adopting protocols of interoperability, HE7 for clinical lab, and procurement and images. Moving forward to the adoption of international patient summary actions, and within the legal and regulatory framework, we have continuous review of the production insurance, ensuring equity in digital transformation. Regarding change, it is not easy to go from the analog to the digital. Therefore, with good practice, we develop teams of professionals, young physicians and nurses, and IT experts, digital natives, and that I insist went to all health establishments, and they trained everything. That is to say, one IT person talking to a physician is difficult, but having a young physician, a native digital, spoke the same language of the diseases, and they stayed in the health establishments, and with that we were able to quickly expedite the digital transformation in the country. Some results during the pandemic. We digitized and issued the vaccination certificates against COVID-19 that could be standardized with the European Union. We have a database currently that is centralized on vaccines for registries by name, moving forward to certification of the national immunization schedule as such. We're moving to the adoption of intelligent public health and based on data. The amount of structured information that is collected allows us to measure and become acquainted with the behavior of health, public health. Besides, in digital networks, it is easy to have digitized return that is helping us to put order with the same system. Therefore, we believe that not only is this helping us in order to develop information systems, but it is helping us to put these health systems in order, classifying and establishing differentiated practices, and that leads to greater efficiency in the health system. On the other hand, we are releasing platforms, educational platforms, the whole issue of remote education, telemedicine, teleeducation, but also teleassistance as such. The interconsultation is one of the projects that we're working on recently. We're working on a measured use of artificial intelligence in order to improve health services and data management. The commitment is to continue moving forward with this digital transformation to change the reality of our health systems. Thank you.
Gracias, El Salvador.
Thank you, El Salvador. I now give the floor to Dr. Garcia Saiso to respond to these comments. Thank you very much, Madam President. And thank you very much to Argentina, Canada, and El Salvador for these comments, and to all member states for the support to this regional policy that undoubtedly plays an essential role in the modernization of our health systems and the adoption of an agenda that will enable us not only to take care of current needs, but future challenges in health that we will face together in the region. The progress achieved in this short period of time with the implementation of this policy is dramatic. No doubt we've heard the appeal in all countries to accelerate the step towards this digital transformation of the health sector. The progress in connectivity and bandwidth stands out, where more populations have access to services that in the past were not available, and especially digitalization in the sense of having access to this broadband service with multi-sectoral approach that enables us to include within the priorities of the government health services in this so necessary connectivity. In digital goods, some have been described as the efforts that we've made in the development of these platforms and being able to share these in our regional environment. Obviously, we stress the progress that has been made amongst all countries for the certification of vaccination processes against COVID-19 that has been so widely mentioned. It is very important to move towards a digitalization of certificates of regular immunization programs to speed this up so that everyone in the region will have access to these digital goods that can also assist us in rendering our processes more efficient. We also stress the progress made in telehealth, those that have been developed, including platforms as those that developed by PAHO, which allows more than 7 countries to have access to a robust platform, which enables us to introduce telehealth services in primary healthcare and thus to bring closer essential health services to the populations. In terms of digital health, which has also been mentioned in these comments as a priority area, here this stands out, precisely this vision towards limiting the effects of these digital gaps on the existing gaps in health, and to always achieve this prioritization of vulnerable populations in access to goods as well as to digital connectivity that's appropriate. In interoperability in the region, it doesn't start from scratch. The region had significant progress with the implementation of these standards, which enable us to have interaction and interoperability that is semantic much before the efforts that are made currently in this transition to the CA11 that has been adopted by all countries and that places us I'm told that I have to go slower since I see that we dangerously approach the closing time of the session. That's why I was speeding up. But I will gladly go slower in making my comments, and we apologize to our colleagues, the interpreters in the booth. This interoperability and precisely this progress that we have in the region nowadays enables us to talk about trans-border interoperability, something we want and that is highly linked to our processes and even tied to surveillance and to having much safer environments with access to priority information at times that are necessary. The approach to human rights, which is besides proposed and considered in this policy, has given rise to the review of many of the regulatory environments and even legislative environments within the framework of this digital transformation, ensuring that we have this prioritization and this link to human rights in anything that is done within the context of digital transformation is essential. It was developed in the regional environment with the participation of most of the member states, a tool that was used to measure the maturity of these regulatory frameworks. And with this to suggest as well areas of specific approach that need attention or modernization within legislative aspects and regulatory frameworks. I also wish to stress the comments in connection with artificial intelligence, where we've urged and promoted the participation of member states in a dialogue that is not exclusive to the Americas. This is a global dialogue which has the intention of establishing how to have access and make safe use and ethical use of tools that are currently available, and also to participate actively in the development of those tools into the future. Another area that is a priority and that is still outstanding in our region is to understand that artificial intelligence is already present in many of the processes that we've seen within the sphere of health and public health. Progress has to be made in developing regulatory skills that will enable us to have an introduction, precisely a more careful introduction, and in keeping with regulatory and ethical frameworks of these technologies in health environments. And this implies a creation of skills and a very close link between health priorities and regulatory authorities so that progress can be made in a sustained way and with a significant change as we move forward. But it is also important here to exchange experiences in connection with the use of artificial intelligence in health environments and public health environments. The safety of information is one of the areas with great growth in demand and technical cooperation, as well as processes within countries. And here I'd like to stress that we cannot speak of acceleration of digital transformation if it does not go hand in hand with a robust framework that allows for the safety of data. If we manage this in a context decades ago, it would be not thinking about the mitigation of fires when we have a room full of paper reports. To think now of these robust frameworks that allow us to have cybersecurity and the protection of data, and with this to tie them to a digital transformation that will enable us to make better use of this transformation, precisely attempts to making our systems more robust, our health systems, and also much more robust and efficient the use of the information available. Last but not least, in connection with the architecture of public health, to put together all these elements of a digital transformation, effective transformation, requires reconsidering many of the elements that constitute the processes within public health. This means not to think of digitalization of those processes that we carry out, but what processes can be carried out with the tools that are currently available and those that can be considered when looking into the future. And significant progress has been seen here, which ties to the very core of the processes of government transformation systems, the health sector that for decades was left aside. So to commend, obviously, all member states for these efforts and for the commitment that we have in this regional path towards a digital transformation of the health sector, to confirm the support of the Secretariat toward these actions and the support for the actions taken by countries, and obviously a look into the future that will enable us to adopt all the necessary measures for the development of the infrastructure that is necessary in the health environments of countries, to develop interoperability norms and standards that will allow us to translate this into a reality not only in countries and health institutions, but within the countries and within the regional and global framework. The creation of capacity as a central area in digital transformation processes, both with new generations that come to join the health sector, as well as those that have years of service and that are essential elements in order to maintain our resolute decisions. We have to talk about policies and frameworks that have to be updated, and also with a look not only to what is possible today, but what will be possible tomorrow. And with this, I conclude my statement, and I'm very grateful for this possibility. Thank you, Mr. President, or Madam President. Thank you, Doctor. I now give the floor to Dr. Barbosa for his comments. Thank you, Madam President. But in a previous topic on health information systems, I believe that I presented in very clear terms all the commitment that we have towards that item. In the digital transformation of health for the benefit of time, it seems to me that I've already made my comments in that regard. Thank you. Thank you very much, Dr. Barbosa. I would like to inform the committee that the discussions will be reflected in the final report.
Continuamos.
Let us now move on to item 7.9, sub-item C, progress reports on technical matters, strategy on health-related law, progress report. I'd like to bring document C 174/INFLA/9C to the attention of the committee, and I invite Dr. Jerry Eickelman, Director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Sanitary Bureau, to come up to the head table. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I will now open the floor to the plenary for discussion.
Doctora Eickelman.
Dr. Eickelman, do you have any comments to make in connection with this sub-item? Yes, very briefly. Thank you very much.
To the member states for having worked in and advanced a lot in this strategy for health-related law, which was approved by the Directing Council in 2015. As you know, the region of the Americas was the first region of the World Health Organization to adopt an explicit strategy for health-related law, which was based at the time on the needs expressed by member states to address the considerable challenges that they faced in creating, implementing, revising the legal and regulatory frameworks, and establishing close coordination between the health authorities, legislative branch, and the other government branches, as well as with other relevant stakeholders. So the vision behind the strategy is that member states should have adequate and strengthened legal regulatory framework to promote health, including from the perspective of the right to health, where nationally recognized, promoting the right to the highest attainable standard of health. And again, despite important progress that has been made on health-related legislation, many challenges remain. And the COVID pandemic has highlighted the importance of the right-based approach and the most effective way to incorporate it in everyday life through its explicit recognition in laws and regulatory frameworks. Strengthening health-related laws is the path, and a very important path, that comes very close to the vision of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The organization will continue to support member states in furthering the work in this area and to provide technical cooperation in advancing this important area of work and keep informing the governing bodies on this. Thank you very much.
Muchas gracias.
Thank you, Director Barbosa. Would you like to address? Yes, I'll be very brief, but I think it's very important for us to stress, just as we have heard. This is a new area of cooperation, one that's very important in order to assist countries in the adaptation of their legislation by way of undertaking reforms to the healthcare systems. But also on matters of promoting health, such as front labeling and tobacco. I'm not going to say all of the countries. I might end up overlooking one, but had meetings with their parliamentarians or congressmen, sometimes enacting a law or not enacting a law can be more helpful for health than a new hospital. So it's very important for the healthcare sector to be able to work with with the congresses of each country, respecting the autonomy of each country, but seeking out a consensus around certain topics. And having that enacted into legislation can also promote health. Thank you very much. Thank you, Dr. Barbosa. I report to the committee that this debate will be reflected in the final report. Esteemed member states, let's resume 4.3, policy for strengthening equity-oriented healthcare action and climate change with health. I must say that this was a very fruitful, the working group that we had was very fruitful, enabling us to arrive at a document. I would ask the rapporteur to please express his comments. And before that, I would say that the document is on the iPads on your desk if you would like to read along with the reading of the modifications. Thank you, Madam President. The working group reached an agreement to modify the title of the proposed resolution. This modification in the title gives rise to a change in the title itself after the operative, the title after the operative part, and then in the first preambular paragraph, as well as in the first operative and the second operative A, letter A, as agreed by the working group by way of making these proposals. The title is Policy for Strengthening Equity-Oriented Health Sector Action on Climate Change and Health. Furthermore, the working group made a substantive change to letter D of operative paragraph 2 of the proposed resolution, agreed by the working group as follows. Second operative, to urge all member states, considering their contexts, needs, vulnerabilities, and priorities, to letter D, create awareness and strengthen community and civil society participation on climate change and health using an equity and human rights-oriented approach. Thank you very much, Mr. Rapporteur. I open the floor on this matter if there are not any objections. There not being any, it is approved.
Permítame.
I would like to offer the floor to Dr. Eijkmans for her comments.
First of all, congratulations. Congratulations to everybody here, because the resolution that you have just approved is extremely important to address one of the most important public health threats that we're facing in the region of this time and of our future. This resolution will support the region to advance with urgency on climate change, adaptation and mitigation, but with the specificity that is needed for this region, putting an equity approach centrally on the agenda. Thank you so much for all the member states for your constructive way, particularly in the working group, to coming to this final resolution. And a special thanks to our chair, Canada, who skillfully led us to this result. Thank you very much, everyone. Given that there's already some proposal for changes or for adjustments in the text of the policy, we are anticipating the organization of the necessary additional consultations with member states so that we can present a consolidated, broadly supported document to the Directing Council. This region has very important opportunities over the coming years to advance this agenda. First, and again, thank you so much to the leadership of Brazil in G20 for putting climate change and equity so firmly on that agenda. Also, we have several events in the region that are really important. Two in Colombia. One is the COP16 of the UN on biodiversity. That's a conference that, of course, very closely related to this, as well as next year's meeting, the global meeting on air pollution and health in 2025. And, of course, most importantly, the 2025 COP30 in Brazil that we're all really awaiting with a lot of expectations, because it will be an enormous opportunity for the climate change and health equity agenda in the region and in the world. Again, thank you so much for countries for approving this resolution towards taking the bold steps that are needed to ensure that the health sector addresses climate change and health with an equity approach at this critical time in our history. Thank you. Muchas gracias. Muito obrigada.
Muchas gracias.
Thank you, Dr. Aikman. I'll offer the floor to Dr. Barbosa for his remarks.
To thank our member states, I think, for this spirit of collaboration. I think that we are discussing a topic that is relatively new in the health sector, but all of us, we recognize how important it is and all the impacts provided by climate change on the health sector. So I think that's very, very important that we can come together and to reach a consensus on this resolution. As Jerry Aikman mentioned, we will keep the conversation going on in order to have regional consultations and to come to the Directing Council not only a resolution but also the policy, the document fully agreed by our member states. I think that this will be a very important opportunity for our region to be on the forefront of the health sector response to climate change. And I want to thank and to recognize the flexibility and the effort, common effort that all member states made to achieve this very important consensus. Congratulations to all of you.
Muchas gracias por sus palabras.
Thank you very much, Dr. Barbosa, for those remarks. We have concluded today's agenda. There are some announcements for tomorrow. Tomorrow, we're going to do our best to make sure that all the pending topics can be concluded tomorrow so that we will be able to conclude tomorrow afternoon all of our work. That just goes to show the commitment, the seriousness that you have given to this work. I'm very happy about that. I would like to remind you about what we're going to be doing tomorrow, starting with 6.1, Human Resource Management for the Pan American Office, document CE 174/28. 6.3, Intervention 174/30. 6.2, Update on the prevention and response to the exploitation and sexual abuse at PAHO, 174/29. 5.5, Ethics Report regarding 2023, 174/8. 6.6, document 174/9. 5.6, Report on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation, document CE 17425. And in the afternoon, we will be looking at 710 resolutions and other actions of intergovernmental organizations of interest for PAHO, document CE 174/INF/10, representation of the Executive Committee in the 61st Directing Council of PAHO, 174/2, draft order, provisional draft order, 66th WHO meeting for the Americas, and other matters that we have pending.
Esto es todo que les tenía que informar.
This is what I had to report to you, and so please, I hope everyone rests up and enjoys their afternoon, and we'll be meeting tomorrow at 9. Thank you very much.